is ahead of our usual start time. Our start time is not the only thing unusual about today. Today is the first time that we've met as a Board of County Commissioners in person in more than 2 years. More than 2 years. It's a blessing to sit alongside my fellow commissioners today as we continue in the work of guiding Lane County's government services and working to improve lives. Before we begin, however, it's important that we acknowledge the hardships over the past 2 years. Think back to January 20th, 2020, when the Center for Disease Control announced the first laboratory-confirmed case of COVID-19 in the United States. Shortly afterward, in February, we established an emergency operations center in Lane County to prepare for when the virus reached our community. Just a few weeks later, on March 17th, Lane County Public Health announced the community's first confirmed cases of COVID-19 and the first local death caused by the virus. Earlier this month, the federal government told us that more than 1 million Americans have died as a result of COVID-19. Spring of 2020 was the beginning of a public health emergency, the likes of which the world has not experienced for over a century. We experienced dark times, but a shining light amid the darkness was how we pulled together as an agency, as a community, to keep our loved ones, our neighbors, and our colleagues as safe and as healthy as possible. The names you're seeing on the screen are the nearly 1,000 Lane County employees and community volunteers who worked day and night to combat the virus here. Many of our employees not only spent their days supporting the county's emergency operations center, they also volunteered their evenings and weekends to help with vaccination clinics and outreach. While it would have been impossible to fit them all here in Harris Hall with us this morning, we do have a handful of folks here who were instrumental in our efforts. To ensure that we continue to remember and understand the scope of what we have experienced over the last 2 years, we will be installing this plaque here in Harris Hall. The plaque reads, "In honor and remembrance of lives lost, businesses affected, education disrupted, time and opportunity lost, and in appreciation of the hundreds of Lane County employees and volunteers who worked tirelessly to keep our community healthy and whole. The frontline workers who provided vital services in the face of personal risk during the COVID-19 pandemic, 2020 to 2022, and it's signed by the members of this board." Before we continue, and before we hear from each commissioner, please join me in observing a moment of silence for the lives lost locally, nationally, and globally to COVID-19. Thank you. Now, as we look to the future, I hope we can focus on healing, cherishing our loved ones who remain with us, getting back to the business of education, getting back to the business of supporting local businesses, and continuing to find a way forward as a community. At this moment, I'm going to invite other commissioners to say a few words, beginning with Commissioner Bozevich.
Thank you, Chair. I just want to take this opportunity to extend my heartfelt thanks and gratitude to the employees of Lane County and the volunteers that stepped up during this crisis. It was a pretty amazing effort in this community to keep a extremely communicable and deadly disease under control. And you know, it's just amazing to me, from the Eugene Rotary that helped at vaccination clinics to folks that spend over 40 hours, you know, doing medical care, then volunteering to actually vaccinate people over the weekends, and then the contact tracers and everybody else that got involved in this effort, to the folks that helped with you know, bringing groceries to folks that were isolating. You know, it just was an amazing effort, and I just want to say thank you to everyone that helped us get past this. Thank you.
Thank you, Commissioner Bozevich. Commissioner Buck.
Thank you, Chair. Now, about 2 years ago, I was the only one on the dais, and our last in-person meeting, everybody was on the phone, although everybody wanted to be here. And nobody knew it would be 2 years later before we could sit back here in person together the way that we once thought was everyday normal business routine. And that's been upended for everybody, clearly. And it's an honor to be back here with my fellow commissioners, with staff, and with everybody in the audience and whomever is watching at home. It's been a lot of work to get here. I too want to thank the volunteers who spent just enormous amount of personal time dedicated to the recovery of our community and to the safety of everybody in our community. Some people traveled out of town to come help. I want to thank them as well. Our staff is just thoroughly dedicated to our residents, and the Health and Human Services agency here is now probably the most well-known division of the county at the moment. And boy, do they deserve a lot of respect and thanks, along with all the other teams who rotated in and out of our EOC, our Emergency Operations Center there, which just recently closed. It's been an amazing time in everybody's lives. And I thank those who participated in really turning around our community so that we are here safe together again.
Thank you, Commissioner Buck. Vice Chair Trieger.
Thank you, Chair. Good morning, everyone. As my colleagues have said, this is a really important and significant day. For me, as your newest commissioner, this is my first time meeting as the Board of County Commissioners here in Harris Hall, and it's really exciting to be here. And I think back over the last year and a half for me in my service, I was here for my swearing in, of course, with an even smaller group than we have here present today. And then I got my first 2 doses of vaccine right here in this room when we converted it into a worksite clinic. So I've been in Harris Hall, but not meeting as the Board of Commissioners and as your commissioners. So this is especially exciting for me. Speaking of looking back, I think it's also important that we look forward. And I think one of the most important things to come out of this experience is we know that there are challenges ahead for our community and for this organization, but we also now know what it takes and what it looks like to really pull together as a team, as large as this organization is, 2,000 employees strong, and their families and the communities we represent, to really do incredibly effective, heart-centered work, because that's what's required when we're called on as the Board of Health to make the kind of decisions we've had to make, is to really do it with science-led and compassion and care for community, because that really ultimately is our job when we're acting as the Board of Health. I want to thank not only the many, many folks that have been thanked already and that we're seeing scrolling on the screen, but really the entire community, because when we're experiencing something like a pandemic, every single person has a role to play. And the vast majority of folks in our community stepped up and did their part with tremendous sacrifice often at times. And the impacts of this will be felt for many, many years to come. And we will be wrestling with the impacts of this pandemic on families, on workers, and on our community. And I look forward to serving alongside my fellow commissioners and this incredible staff to continue to do the important work as your Board of Health, whether we're wrestling with large or small issues. I have every confidence that we will do it with integrity and be really effective to serve our community. So thank you all so very much for all that you've done these last 2 years and will do in the future. Thank you, Chair.
And thank you, Vice Chair and Commissioners. Ms. Mokrahajski, as the names continue to scroll, I'm going to mention a couple of folks in the audience who've meant a lot to me over the last 2 years. Just folks sitting over beside me, I'm going to mention first Alana Holmes, who is the head of our Human Resource Department, a particularly stressed department right now as we struggle to recruit and retain our valuable employees. I'd like to point out Steve Adams, who has been a loud and strong voice throughout our board meetings for the last almost 2 years, providing us with data, information, and guidance as we move through the pandemic. I'd like to say hello to Eve Gray, who has taken over as the head of Health and Human Services and is doing a superb job of picking up and guiding us into the future. Patience Winningham, who is in charge of our emergency preparedness, and Patience, that you've been from day one, you've been on the job day and night. I don't know even when you sleep, Patience. And I'd like to especially welcome back Karen Gaffney. Karen, is our now retired head of Health and Human Services. Karen, how much work did you do during the COVID-19 pandemic? Thank you very much, and thanks for being here this morning. At this point, Mr. Mokrasky, the scroll will continue, and we do have a few more moments before we will recess the meeting. So I'm going to go into a little bit of detail about what's going to happen next today. At 9 o'clock, we'll reconvene in a joint meeting of the Board of Health and the Board of County Commissioners, which will last for approximately 1 hour. At 10 o'clock, we will reconvene as the Board of Commissioners. At that point, we'll take 30 minutes of public testimony. We have a very strict time frame today with a 10:30 time certain, where we have a number of people who are both flying in and traveling in to the board meeting today. So public testimony today will be limited to 30 minutes. If we have more than 10 people signed up, the time will be reduced from 3 minutes to 2 minutes for the public testimony today. And there will be a hard stop at 10:30. I'll apologize ahead of time for people who may have signed up who may not get a chance to actually provide oral public testimony today. The written public testimony can be submitted and considered in the public record for the next scheduled board meeting. Thank you very much for being here this morning. And you know, Mr. Mokrasky, this is a long list of people that are being scrolled, and I'm not going to adjourn us until we've seen every name. So I want to once again thank everybody for being here this morning, and look at the names, I guess, as we sit here.
Could take a while.
This could take a while, Mr. Mokrasky. I'm going to look for your advice on this. Can we move along, or shall we continue the scroll?
I think it'd be great to just allow the video to play, and we can sit and recognize and reflect on the last couple of years, and recognize the folks who've contributed so much here, and again, remember those who were lost to the pandemic.
Thank you. And, you know, I'll mention one other thing regarding public testimony, Ms. Mokrasky, as we move forward. When we do arrive at public testimony, we will be taking testimony from people who are live in Harris Hall, and from people who are on the phone or in video, zooming in. We'll alternate testimony between live people who are live, and people who have phoned in, with the first 5 testimonies being from people live, and then Ms. Jones will control the queue until 10:30 once again, when there'll be a hard move along to the 10:30 time certain. So with that, we have a moment to reflect. Board. Commissioner Bozovich.
Thank you, Chair. So I just also want to recognize Karen Gaffney, our former head of Health and Human Services. What you did not mention was she was the original incident commander for COVID, and was prescient enough to set up our incident command well ahead of when most jurisdictions did. When was that? January we set up IC? Yeah. So, you know, we were prepared, much more prepared, I think, and were running on all cylinders as we came into this extremely unknown disease. I mean, right now it seems kind of, you know, even though we're dealing with a slight surge, we're not seeing the hospitalizations because, you know, people like me, I just got my second booster last week. You know, so it's become kind of, don't remember what it was like. We had no idea what, you know, how deadly the disease was, who it was going to impact the most. We had absolutely no treatments available at that time. We didn't understand how to treat for the disease. Think back to February of 2020 for a moment and just remember what it was like. There was no vaccination. We didn't understand treatment. And then we were seeing people go, you know, and have to go on ventilators and weren't surviving. And what was really distressing was we were seeing it in veterans' homes here in Oregon. And we're losing World War II veterans to this horrible disease. Now, that was February 2020. Now today, in May of 2022, We have vaccinations available. We have multiple different treatments available, and you're just not seeing that kind of mortality rate. And really it's due to a lot of hard work, and it's amazing we just didn't see more deaths from this disease. And it was, you know, the hard work led by our incident command structure, the contract tracing and isolation that we were able to do. It was just all hands on deck for something that was completely unprecedented in modern times.
Thank you, Commissioner. Ms. Mocarese, I've just seen Lucy Zamarelli's name and Pete Zugelder's name, which is the end of the scroll, alphabetical order. Vice Chair Trieger.
Well, I just wanted to also appreciate and acknowledge our Public Information Officer, Devin Ashbridge, because all of the important work of this organization, whether we're dealing with emergencies around snow and ice or wildfires and smoke and heat events, and certainly during the pandemic, gets the word out along with a team at public health as well of public information. But really, we're here for the public, so having someone who helps get the information out to the public is just critically important. So I wanted to appreciate that effort and her work to help get this commemorative plaque produced so that every time we come in and out of this room, we remember the importance of the work that we do under great duress, which is really the measure of the strength of an organization. Thank you.
Thank you, Vice Chair. I'd like to take a moment to ask Ms. Gaffney to step to the mic and say a few words. Thank you.
Thank you, Chair Farr and Commissioners. And as I was listening to you reflect, I just wanted to thank you for your leadership during this work. I think you've called out all the great work of the staff, which is absolutely true. And Commissioner Bozovich, I appreciate you hearkening us back to those days when we didn't know what we were up against. And I appreciate how the board truly stepped up into that role of Board of Health and in working with us to figure out what the best ways were forward and to support us and the community in all of the many ways that you did. I remember when you thanked Devin, one of the things Devin did was partway through the pandemic, help craft COVID coins that we were able to distribute. And in the notes that went with those, I remarked that this was the great pandemic of our time, and all of us years from now will reflect back to what our role was and how we really stepped up for our community during that time. So I didn't want today to go by without appreciation for you and your role in all of that too. So thank you.
Thank you, Karen Gaffney. Then with that, I'll let Mr. Mocarese, I acknowledge that Commissioner Joe Burney is not with us this morning, excused absence. At the sound of my gavel, we will be in recess until 10 o'clock when we will reconvene. Thank you. As a test to see if you were listening. Almost got it. And you were. You passed. Until 9 o'clock when we will reconvene in a joint session of the Board of County Commissioners and the Board of Health. Thank you. I'd like to convene this meeting of the joint meeting of the Board of County Commissioners and the Lane County Board of Health. Welcome to Harris Hall this morning. I'd like to mention that masks are welcome here in Harris Hall. You're welcome to wear a mask. If you choose to do so, we support your choice to wear a mask. Thank you for being here this morning. Ms. Mokrajewski, today we have a joint meeting of the Board of County Commissioners and the Board of Health. I'd like to ask you any adjustments to the agenda?
No, none from staff.
To the board? I see none. Any emergency business for the Board of Health?
No.
I see none. Then we'll move along to item 3A on our agenda, which is Health and Human Services. Before we get started with Health and Human Services, I'd like to mention once again that at 10 o'clock or so, we'll be beginning our public comment period. We have a 10:30 time certain today, which is a hard time certain, so public comment will cease at 10:30 today. So with that, Ms. Mokrajewski, I'll turn it over to you to introduce your panel for the Health and Human Services report.
Here we have Eve Gray, our Health and Human Services Director, is here with us, Dr. Guzman, and I'll turn it over to Dr. Warren to introduce the item.
Thank you, Commissioners and Chair Farr. We are very happy to be here today. I would like to just add one thing to our acknowledgement, if you don't mind, is I want to recognize the many families who supported their loved ones in the response. All the support and encouragement was really important for those who were able to show up every day, and it really created the environment that allowed us, I think, to be successful. So there are thousands and thousands of people actually who participated in this response. So thank you very much for letting me do that. I think it may be a measure of sort of our return to what will be our normal operations to bring to you today a semi-annual Board of Health report that is not about COVID. We are bringing today to you a presentation on sexually transmitted infections in Lane County. This is not a new topic of conversation at the Board of Health. We have been discussing sexually transmitted infections for some time, and with the end of this new phase of the pandemic, I will say, we are really committed to redoubling our efforts in this area. So today I bring Dr. Lisandra Guzman. She is the Associate Medical Officer for Lane County Public Health, and she will be doing the presentation for us today. Dr. Guzman.
Welcome, Dr. Guzman. Thank you.
Thank you. Okay. Can you hear me well? Okay, thank you. So yes, my name is Lisandra Perez Guzman. I've been with the county for 10 years this year. So I'm looking forward for my 10-year pin. I have the 5-year one on. I can't believe it's been 10 years. So I work for the Communicable Disease Department as one of their supervisors, and I also lead the STI clinic there. And so today I want to talk to you a little bit more about STIs, the trends, age range, the syphilis epidemic, and congenital syphilis. Okay, so why are we talking about STIs again? That's because STIs is a big deal. About half of new STIs in the U.S. annually are among or between the age of 15 and 24-year-old. This population consists of 25%. So 25% of our population is between 15 and 24, and half of the STIs are within this group. That's huge. Chlamydia and gonorrhea, they cause, it's not just an infection where you go and get an antibiotic and you're done. It can cause havoc in your body. It can lead to pelvic inflammatory disease. This pelvic inflammatory disease can lead to infertility. It can lead to ectopic pregnancies, and it can lead to chronic pelvic pain, among other things. Syphilis is even worse. Syphilis can cause damage to the brain, to the eyes, to the bones, to the skin, to the joints, to the liver. It leads to blindness, hearing loss. It can lead to dementia. It can lead to your skin deforming. It can lead to paralysis, and it can also be transferred to the fetus and lead the baby to be born without a live stillbirth. Syphilis is also quite costly. It can range between $680 to a little less than $300,000. And why is that? Syphilis is very complex. It's a very complex diagnosis. It requires a lot of investigative work. It's not just you've been diagnosed with syphilis, here's your medication, go home. We have to identify the stage that they're in because that determines the treatment. And that requires a lot of investigative work as to previous labs that the patient has had, and a full neurological examination to make sure that there's no neurological symptoms. Because syphilis can, at any point in time, it can go into your nervous system. And from then on, the damage that it's caused it's irreversible and requires IV treatment, not just a penicillin or bicillin injection. So syphilis requires DIS, which is our disease intervention specialist. These are the people that actually do the contact tracing, and we're actually involved in the contact tracing for COVID. And they need to identify, and not just for syphilis, but for gonorrhea, every case of gonorrhea, and every case of chlamydia in pregnant females, every case of syphilis, and every case of HIV. These 3 people that we have now, they do the contact tracing, they do the partner services, so they try to contact every partner that this person has had. And so we do the same thing. We try to bring them in, test them, and treat them. It's a very also complex community in the sense that it's a bit of a challenge to bring them in, to bring our patients in. When they're missed, when they go into the ED and they are misdiagnosed and they turn out to have chlamydia or syphilis and they have to be brought in, it requires multiple calls to bring patients in and get them treated if they come in. And for this, we use a lot of incentives to interview them, incentives to bring them in. And when we say that the treatment is unpleasant, they've jumped off the bed and walked out without treatment because it's not pleasant. So it's complex and requires a lot, which brings the cost up. So that's why STI is a big deal. The other reason is in 2020, or among the reasons, in 2020, 32% of chlamydia, gonorrhea, and early syphilis, which is primary and secondary syphilis, were among Hispanic Black persons, 32%. And this population consists of 12% of the US population. MSMs are disproportionately impacted. Per the CDC, it is unlikely explained by differences. So this disproportion is unlikely explained by differences in sexual behavior, but rather by access to quality sexual health care and the sexual network characteristics. So say you have neighborhood A and you have neighborhood B. Neighborhood A is known to have a high number of STIs. Neighborhood B.
I do believe somebody has their microphone on, somebody who is zoomed into the meeting. If you can check your microphones, please, to silence them. Thank you.
Can you hear me now?
Yeah.
Okay. So neighborhood A has.
Fucking kidding me.
Can you mute your phones, please? Thank you. Okay, so neighborhood A has a high rate of STIs. Neighborhood B has a low rate of STIs. Me, if I go and have sex in neighborhood A, I will be at a high risk of getting STIs. If the same person goes to community B, my risk is lower, just because the risk in the community, the rate in the community is lower. So it's not the sexual behavior as much as it is the sexual network characteristics and the access to quality health care. So this is a slide from the CDC. This is a list of all the STIs. You have HPV, HSV, so it's not just chlamydia and gonorrhea and syphilis and HIV. You have a bunch of other STIs. We're going to look at the lime green. The lime green is the incidence. How many new cases of these STIs occur annually? And I believe that this slide is from 2018. If you look at incidence, and I'm going to go on a tangent here, just because trichomonas is my favorite STIs. Trichomonas is the most in count of STIs that we have. This is nationally, and I'm sure that this is local as well. The problem with trichomonas is that it's not reportable. So that's why you don't hear much about it. But it is higher than chlamydia and gonorrhea combined. When we look at the reportable STIs, chlamydia, gonorrhea, and syphilis are our top three. And that's why we focus so much on that. Collectively, they cost $60 million in the US, $60 billion of direct medical costs. That's pretty expensive. So there you have it. These are your three amigos: chlamydia, gonorrhea, and syphilis. So let's look at trends. These are all numbers purely for in Lane County. The numbers are a little bit small, but if you look at chlamydia, the graph of chlamydia, which is the red one, these are the counts that we've had since 2009. And 2022 seems low for all of them, but that's because we've only had 4 months. We're 4 months into it. The data is until April 30 of 2022. So for chlamydia, we had a small dip in, we had a dip in 2020. If you compare for 2022, if you compare that, actually that bar in 2022 is from January to April 30, 2022. Now, there's a percentage underneath. It's minus 5% change. What that means is that last year, when we compare our numbers this year to last year, at the same time frame between January and April, we're about the same, minus 5% change comparison to last year. So we're, if I can predict what the year is going to look like, we're probably going to be even. When we look at gonorrhea, gonorrhea dipped a little bit in 2021. And if we compare last year to this year, it's about negative 3% change. So it's about the same thing. When we look at, let's go down to HIV. HIV, we had a dip in 2019. When we look at last year to this year, we are 50% higher than we were last year at this time. When we look at syphilis, syphilis is wild. Syphilis has just been going up since 2018. It's quadrupled the numbers. If you look at the percent change, that percent change, that's not a mistake, 200%. 200% increase when you compare this year to last year, the first 4 months of the year. It's wild. And when you look at the graph at the state level, which I didn't include, but chlamydia looks similar. It dips in 2020. Syphilis dipped a little in 2020, but when you look between 2020 and 21, it's pretty steep. That's the main change of syphilis between the state and us. We just continue to increase. So why the decrease? We don't know yet. The decrease in chlamydia and gonorrhea rates could be attributed to lack of access to testing. We did have a reduction in hours in many clinics. Some clinics closed down. We had the stay-at-home orders. There were shortages of our STI kits because these kits were also used for COVID testing. And some people lost their jobs, so they lost their insurance. Mind you, your CD clinic never closed. We were always open, and we continue to see patients for screening and treating STIs all year long. Yeah, we reduced our hours a little bit, but we're still open. Another reason for the decrease could be because we switched to syndromic testing. That means that patients were being seen because they had symptoms, not really for screening asymptomatic people. And chlamydia is one of those that likes to be quite silent and not show symptoms. There was an increase in virtual sex and a reduction in casual sex. Those could possibly have been reasons for which we saw a decrease in the numbers in chlamydia and gonorrhea. The CDC also does not, the CDC reports that they also believe that the cause is not because we have a reduction in infection, but that we have a lot of missed cases out there. Now, if we look a little bit on the age range, just as an FYI, gonorrhea, if you look at the green, it's mainly in the 20-year-olds, 20 and 30s. If you look at the red, that's chlamydia. That's mostly between 14 and 20-year-olds, very, very young. If we look at syphilis, syphilis has been quite spread out. Last year, it was between 20s and 40-year-olds, and then HIV is also a little bit spread out, a little bit higher in the 30s. That's just so you can get an idea of the population where these STIs tend to land. But the most impressive for me is usually the chlamydia, which is in the much younger teen population. Now I want to focus a little bit on syphilis. We have an epidemic. We do have a syphilis epidemic. And just the thought that syphilis could have been and was almost eradicated in the 1990s, it just blows my mind away. So syphilis has managed to go from nearly eradicated to create an epidemic. STIs increased nationally by 30% between the years of 2015 and 2019. And the sharpest increase has been in congenital syphilis and babies being born with syphilis. The MSM community are disproportionately affected, although heterosexual syphilis epidemics continue to increase. So we are seeing that before syphilis was predominantly in the MSM community, now there's an increase in the heterosexual community, and that's why it's affecting more females. And so we would expect an increase in congenital syphilis. So this next graph, the blue graph that you see going down, that's the ratio between male to female in syphilis rates. So that's to tell you that from 2013 to 2022, the number of males are decreasing and the number of females are increasing. And then when you compare that curve with the congenital syphilis curve, you see that the congenital syphilis is going up. Previous to 2014, this is all Lane County numbers. Previous to 2014, we had 0 cases of congenital syphilis. The 2022 is shaded because that's this year, and that's going to change. So as I said before, congenital syphilis occurs when the syphilis is transmitted from mom to the baby during the pregnancy. It is preventable. And here in Oregon, so the CDC recommends that pregnant females be checked for syphilis twice during their pregnancy. In Oregon, that's different. In Oregon, it's 3 times. In your first prenatal visit, in your first trimester, in the beginning of your 3rd trimester, and at delivery. That is extremely crucial, and treating our patients early if they have syphilis is extremely crucial. And I'm going to show you what happened in our county in a moment. But deafness, intellectual disabilities, and physical deformities can occur later in life when babies are born with congenital syphilis. So this is between 2021 and 2022, we had 12 cases of pregnant persons with syphilis. We had 12. It's not a high number, but half of these 12 went on to develop congenital syphilis. So 12 babies, 12 moms with syphilis, half of them developed congenital syphilis, half of them did not. Why? What was the difference there? So the 50% that developed congenital syphilis, 50% were reinfections in the same pregnancy. 83% had substance use, 83% were treated late in pregnancy and had previous STIs, and 100% of them either had late prenatal care or no prenatal care at all. The 50% that did not develop congenital syphilis, 100% received early prenatal care, were diagnosed early and treated early, 33% used meth and nicotine, and none were reinfected during pregnancy. So we found that timely prenatal care and timely testing for syphilis and continuous testing for syphilis were protective. That's what happened in 2021 and 2022. And we had that we know of, we had a stillbirth this year. So our current efforts, we have been collaborating with WIC and FCH, previously known as MCH, and we have a referral system where we refer to them patients that need their services, and they refer to us patients that need testing. We also collaborate with the HIV Alliance. We provide them with pregnancy tests, and they do syphilis testing, primarily focused on persons of reproductive age and the unhoused. The public health prevention team also has 2 assessments, one in K through 12, and they do assessment of sexual health education in schools. They're trying to know what is the curriculum in schools, how much they're learning in terms of sexual health, and how much time they're spending in sexual health education, and also pediatric assessment, where they look at pediatricians and what their workflow is, and what their clinical practices are. We also have increased STI hours. We have a new LPN. We used to have 2 DIS, now we have 3. And we are also doing PrEP services, pre-exposure prophylaxis for HIV, to prevent HIV. Now, some of the future work, we are preparing. I'm sure you know that we have a mobile clinic now. We are preparing to do cross-departmental mobile clinic services. So if CD goes out to test for STIs, we want to bring MCH or FCH to provide their services too. And the goal is to be able to work in remote areas. We are also looking forward to doing gender-affirming care training for all of our staff. STI awareness campaigns through social media. This is extremely important. I don't think we've spent a lot of time in doing campaigns on STI and educating our community broadly, not just one-to-one in our clinic. And we also want to increase awareness that our clinic is present in the community. A lot of people do not know that we have these services, and we want to make sure that the community know that public health is actively working in protecting their community, and that's our main interest. And now I'll pass it on to Jocelyn.
Thank you, Dr. Guzman. Chair Farr and Commissioners, I was asked to provide a short update on the fee-for-service reduction for syphilis that we experienced recently. So I just want to give you a little bit of background on that. In 2019, the CDC provided additional funding for support for pregnant syphilis cases in the states. And that was then passed on to counties through a fee-for-service model. So at that time, we were given $1,125 for each pregnant case and an additional $500 for each partner to support the very complex and additional work that Dr. Guzman just explained. Those fees have been reduced to $750 and $250 respectively, because that one-time funding from the CDC has ended. So the Oregon Health Authority is using general fund to provide that additional funding this year. We don't know if it will continue in future years. Overall, it's not a very large contribution to our budget. It's about $17,000 in the previous year when it was at its higher reimbursement level. However, of course, any reduction is a concern, especially as the cases continue to rise and we are expanding our STI clinical services, especially out in the remoter areas of our county, which is our primary goal. So that concludes our presentation. Thank you.
Drs. Guzman and Warren, thank you very much. Ms. Gray?
I think they did a wonderful job of describing, so that in case anyone reads lips out there, I think they did a wonderful job of describing the concerns that we have related to sexually transmitted infections in our community, and just wanting to make sure that our community is reminded that though we have been focused on a single infection of COVID over the last couple of years, we still have other infections that we need to be tracking very carefully, and really bringing our attention back to some of these other diseases that are present in our community to keep our community safe.
Thank you, Ms. Gray. And I'd like to point out that your many years in healthcare, I'm certain you've seen the spikes and valleys, and it's pretty alarming, the spike that we're going through right now. Before I go to the queue for questions, very quickly, I was a sophomore at Tillamook High School in 1969. We had health that year, sophomore year, you had health. And it seemed like about half of the year was devoted to very graphic and very frightening studies of sexually transmitted diseases. Maybe it was the times, but my question is this: as K through 12, in high schools, are we doing less education on this front? Is it something that we need to focus on a little bit more? That's a quick question that you may or may not want to answer right now before I go to the queue.
That's a very good question, and I don't know the exact answer, but what I have heard within my team is that they may spend maybe one day or half a day or a lecture, actually, in their 4 years of high school. Personally, I remember 1 hour of lecture.
That is frightening to me because it was drilled into us. Now, once again, perhaps because of the time, 1969 was a very different era than it is today. But I remember Roscoe Slider was my teacher, and I remember his face and the serious nature of the things and the graphics frightened the people, rightfully so, frightened the people in the room. And I don't know if fright is the best form of addressing the issue, but it certainly worked at Tillamook High School in 1969. I'll go to the queue for Commissioner Buck.
I have a question on the reporting of the numbers and how that's done. I'm guessing some of these people that are infected go to their pediatricians or they go to their primary care doctor. They don't always necessarily come to our clinics in and of itself. So how does the coordinated effort of reporting come to Lane County? And then the other question I have is, do we ever see like a main outbreak, or is it just pretty steady as you see it come throughout the year?
Yeah, we definitely see outbreaks, but more than not, what we see are individual cases that may have partners that we reach out to. But not so much like outbreaks. Like I remember I think it was 2015 where we had an HIV outbreak, but most of these are individual cases with a few identifiable contacts. And the first question was about how we get the numbers.
Right. How do we coordinate getting the reports of numbers into the county so we get graphics like what you showed us?
Mm-hmm. So these numbers come from Orpheus, and this is a database that belongs to Oregon. When a person goes to the lab and they test positive for a case, the lab and the provider, they're both required to report to us. So they have to call us or they have to fax us a form, a dedicated form. And so those results, that is also reported to the state, and that goes into the state database. So it kind of goes from us to the state and from lab to lab, or lab to the state. And that's how they're able to gather this data, because it's reportable, and by law, the lab and the providers, they have to report it. And that's how we're able to get these numbers. We cannot get these numbers for trichomonas because it's not reportable. We would have to go to claims data, insurance data, to be able to gather the majority of the data out there. A lot of legwork for that.
Thank you, Dr. Guzman. Thank you, Commissioner. Vice Chair Trieger.
Thank you, Chair. Thank you for the sobering presentation. My first real job in the early 80s was at a women's health center in Philadelphia, and I remember at that time being really alarmed at the number, particularly of young people that came in with sexually transmitted infections, and specifically at that time, syphilis and gonorrhea. And then, of course, as you mentioned, almost eradicated syphilis, and here we are. So the more things change, the more they stay the same. One thing I would comment on, Commissioner Farr, Chair Farr raises an important point about sexual health and sexual education in schools. Oregon is one of just a handful of states that has a comprehensive sex education law on the books that requires not doing sort of scare tactics education, but doing comprehensive sexual health education. But clearly, at least here in Lane County, we still have a lot more work to do. And so I'm really curious, it's impossible to ignore the link between early prenatal care or the lack thereof, and the rates of infection. So what, if anything, we are doing or can do to increase outreach and engagement with people who may become pregnant to get them into prenatal care as early as possible, and the screening and support that goes along with that is my first question. And the other that sort of links to that is because of, like everything, the disparate impact of these communicable diseases on our BIPOC communities, and in this case, particularly on young people. How are we working with community-based organizations or other non-medical settings where there may be more trust for folks to receive the information, education, social media messaging, and so on? So what are we doing specifically at Lane County? Because your report calls for, quote, urgent and appropriate response. So what are we doing with urgency around outreach to specific disparately impacted communities, and how can we as the board help?
So pre-COVID, we were going to Highway 99 and we were testing there. We also had connections with some local CBOs where we would go and test for STIs at their site. During COVID, well, this stopped. But we want to re-engage again. We've been having conversations with a handful of partners where our goal is to be able to start that, and not just here in Eugene, but in the outskirts and rural areas. Do you have anything to say?
Thank you, Commissioner Trieger. Vice Chair Trieger, that's a very good question, and I think that is going to be the focus of our mobile health services. We've recognized that this is our most urgent need now coming out of the pandemic, so some of the resources that we have used to control COVID will now be redeployed to this effort. So it requires more collaboration and more communication with our partners because you're right, the community-based organizations are a great opportunity to help present these services in a way that might be more acceptable for people for whom government is a barrier. So that's beginning now, and so we look forward to reporting on how those services are evolving in the coming months. Thank you.
And if I might, Vice Chair Trieger, the only thing that I might add is just to say, of course, the complication in dealing with a disease that is stigmatized. And I think that addressing the stigma around sexually transmitted infections is crucial in order for us to get to a point where we can successfully identify infections early and treat them effectively. So that needs to be an area of focus as well, and an area of conversation.
I could, two brief points to follow up. One is just a question I meant to ask at the top. The trichomoniasis is not reportable. Is that per CDC, OHA? Are those cases, do we know the numbers are high just because it's incidentally discovered in the course of other medical care?
Yes, incidentally discovered.
And is it, who determines which and which are not reportable?
I believe it comes from the CDC, higher than OHA. I've contacted OHA about this, and they've told me that it's not reportable. So they understand the struggle, but it's not reportable. So it's above.
Thank you. And I guess part of where I'm going with that, since you mentioned, the CDC reducing payments to the state, which then reduces payments to us to address this, is whether there are opportunities for advocacy or anything, again, that we can be doing, whether it's around what or how is reportable to make the case for our need for resource to address this public health crisis, or just that funding piece, right? Clearly, that's always a big part of our capacity to address, on top of the destigmatizing the issue and more promotion and education and partnership, whether there's anything we should know about or could do to support getting more resources to our public health department specifically for this.
Thank you, Vice Chair Trieger. There absolutely could be. I think part of the goal of public health modernization is to allow greater flexibility at the local level to identify priority areas and target resources to those areas. I think there absolutely is an opportunity to advocate for greater funding for public health through public health modernization in the next biennium.
Thank you, Chair.
Thank you, Vice Chair. Doctors. Commissioner Bozovich.
Thank you, Chair. So quite often in these reports, you have us compared to the state average and U.S. average, and I guess my question somewhat is to kind of put this a little bit in perspective. We see our case rate growth, which is bad for syphilis and HIV, but I'm kind of, is this a trend nationally? And then if you could. I'm just kind of curious, how does the U.S. compare to other countries with these STIs? Are we have a higher case rate per 100,000 or million than other countries? Or are we? Because I want a follow-up question about human trafficking.
Commissioner Bozovich, you got me there. I don't know about how we compare to internationally. I do know that nationally, our trend is comparable. Even the CDC had an article a few weeks ago on how the trend of STIs has been increasing nationally, and how COVID affected that trend. So I know that it is comparable, and also in Oregon, similar trends as well, where we've had increases in all STIs, especially in syphilis. We can provide you with details of the actual rates and the trends of the state and Lane County, so that you may be able to compare those two. But I don't have the actual data right now, just the graphs.
So, one of my concerns, and has been a concern of mine for quite some time, is the amount of human trafficking that happens along the I-5 corridor. And human trafficking is such a simple name to put on something that's basically modern slavery and a horrible practice. But I am concerned that human trafficking, particularly of sex workers, can be traced to some of these increases. But along with that, our ballot measure 110 that passed and seemingly causing a large spike in Oregon's overdose rates, and we're seeing other conditions that are changing in our state relative to IV drug use. The combination of the two concerns me that has some impact in this, but the adverse indicator of that is it seems to be mostly in the MSM population, which tends to not be as trafficked. but there is still some trafficking of sex workers even in that population. So any thoughts on any correlation between this increase in these, in particularly syphilis and HIV, that have those connections between IV drug use, which a lot of trafficked people are forced into, and just this whole increase in those particular diseases?
No, I mean that we don't have any data on the human trafficking. We can gather data around HIV and drug use, and I can provide those to you at a later time. But we do have that data.
It was eye-opening to see in your congenital syphilis description of the 12 pregnancies, the high amount of drug abuse that was involved in those particular pregnancies.
Yes, I believe it was 83%.
Yeah, so that's it all ties together, and you know, it's not just so much about educating, destigmatizing STIs. It's about dealing with the substance abuse epidemic that is going on here in Oregon, and because that leads to ignoring all previous education, you know, because you're looking for that dollar to get the next fix.
Yes, Commissioner Brozovich, that's definitely an issue, and we see that trend in most STIs, but especially with syphilis, and now with the congenital syphilis cases, definitely see that link.
Thank you, Commissioner Brozovich, and thank you, Director Gray, Dr. Guzman, Dr. Warren, for a great, not a great presentation, but a very informative presentation. When I spoke about Tillamook High School in 1969, I talked about the extensive health classes that we have. One thing that we did get out of it, and that I personally got out of it, is identifying symptoms. And I think that's key, is identifying symptoms so it can be reported, so it can be treated, and thereby doesn't spread. So we have a large body of work ahead of us to curb the increase that you're describing, Dr. Guzman. But with that, Director Gray, anything further?
No, nothing further from me.
Ms. Mokryski? Thank you to the board, and thank you for a very informative discussion. I'm going to point out that in today's agenda packet, if you're following online, if you click View Material, a very extensive report by the doctors and by Director Gray on the presentation that we received today. Thank you once again for the semi-annual Board of Health meeting. Then, Board, at the sound of my gavel, we'll be adjourning the joint meeting of the Board of Health and Board of County Commissioners, and we will be reconvening as the Board of County Commissioners, at which point Mr. Mokryski will move directly into public comment following emergency business, and then we'll move forward into our 10:30 time certain. A reminder that we have a hard time certain today that public comment will cease at 10:30 today. We have a number of people signed up who are present in Harris Hall to deliver testimony. Ms. Jones will be managing that queue. I'll remind you once again, once we reconvene, Ms. Jones will be managing that queue. The first 5 testimonies will be received from people in person, after which point we'll go to a staggered and alternating approach. So with that, at the sound of my gavel, we are adjourned as the Board of Health, Board of County Commissioners, and reconvened as the Board of County Commissioners. Welcome back. Seems like almost no time passed. Very good. Then we'll move along with our regular commissioner meeting today, starting with emergency business. Mr. Mokryski, do we have any emergency business today?
We don't.
We have none. To the board, I see none. Then we'll move directly into public comment. Once again, a reminder that we currently have 10 people signed up, so we will be allowing 3 minutes per testimony. You'll be called in order. Ms. Jones will be managing the queue. The first 5 will be taken from members, if there are 5 at a time. I believe we do have a couple more people who will be showing up. The first 5 will come from in-person testimony, and then we'll move to a staggered approach with the hybrid meeting on Zoom. Ms. Jones, will you handle the public comment queue?
Unfortunately, I cannot handle the public comment queue in person. That will be on the chairs. That is part of your role. You should have the list of people to call.
Very good. And then
I do not have that list, and you can call them up, and I will start the timer, and you will manage that queue. I do not believe you have more than 5 people listed, so once all of our in-person public comment is done, I will take over and run the virtual queue.
Thank you very much. Then I will, pardon me, everybody, if I stumble through this. We've never done this before. We're back after 2 years, and we're moving into a hybrid form of public testimony. We value public testimony tremendously. Typically, we don't have a time limit on public testimony, but today is an unusual situation. So I have in my queue, if you are here, Alan McWayne. Is Alan McWayne here? And I will call on Kim Morrison. Is Kim Morrison here? I've indicated that both of those will return at 10. Then we have Nicholas Anselmo. Mr. Anselmo, please step to the dais. You'll have 3 minutes once you begin speaking. The timer is on the wall. After 3 minutes, we will move along to the next speaker. Thank you.
Thank you. It's good to be in person and see you guys face to face. This is really nice. I noticed the extensive building, very nice. Lots of money. It looks like that was used to build this. All the screens and everything, and the cameras. It's amazing that we couldn't have done this earlier. Seems like we have plenty of funds and money to fund our wildest dreams. The American people are suffering. Lane County is suffering. You scratch your backs and you say, "Oh, yay, we did such a good job. Everyone did such a good job with the lockdown." We know that studies have shown that the lockdowns didn't do anything. Masks don't do anything, not to stop the spread or to prevent hospitalizations or any of that. It's interesting to me in government, you always have huge egos, and no matter how much destruction you do, you always find ways to scratch your backs and to say how good you do and focus on it's either what's bad is not your fault and what's good is your fault. And that's just concerning to me. And the fact that you continue to say what a great job you've done when all you've done is cause inflation, cause people to not be able to have housing, to afford gas, to be able to just function in a daily setting. And it's really disturbing. And I was just at the store the other day at Comcast, and I had people all around me talking about how they're afraid and how they're sick, and they've been fully vaccinated, fully boosted, and they've been sick for months. And oh, thank God, if I didn't get the vaccination, I would have probably died, or I would have been in the hospital. And to say that and to see that in real time is a trip. It's actually incredible because there's no way you could really know that. I'm unvaccinated. I've never worn a mask, and I serve tables. I serve in around people all the time, and I haven't been sick for several years. And I just don't understand why you continue to parrot this and just in denial of the reality because of your egos and because you have all this corporate money and this governmental money and all this pressure. And I also find it interesting that you all vote the same way all the time. There's no diversity among, I would say in the exception of Jay, but there's no diversity, and there's no diversity in our politics, really, literally, like with this possible nuclear war where all of the Democrats voted for it, most of all the Republicans. You're on the side of Mitch McConnell. You're on the side of these really sleazy people. And I'm shocked Bernie Sanders voted for it. It's disgusting. He's supposed to be anti-war. And this is, I know that's on a national level, but it's also on a local level as well.
Thank you. I'll go back to the queue to see if Alan McWayne is in the audience. Kim Morrison in the audience. And I believe the indication is that they would come back at 10 o'clock. So what we'll do is we'll move forward with the balance of the agenda. Ms. Jones, I'm presuming we have no one online for public testimony.
Chair Farr, we do have people online.
We do.
So we can move. Yes. Yes.
Then we'll
so
move directly into online. Thank you, Ms. Jones. Can you manage the online queue?
Yes.
Very good.
At this time, we'll begin our virtual public comment. If you have signed up to give public comment at this meeting, please raise your virtual hand now, and I will call you in the order that you have raised your hand. This is kind of a last call, so if you do plan on giving public comment, please raise your hand now, and we'll move through you. Just a reminder, it is a toggle, so if you press it more than once, it takes your hand down and then puts it back up. So with no further ado, we will begin our virtual public comment with Ann Neeland, followed by D. Love. Ann, I will unmute your microphone and you may begin your public comment. Ann, I do show yourself muted. There you go.
Okay, good morning. My name is Ann Neeland, and I want to talk to you today about technocracy. Technocracy is a means of globalization, and it is alive and well today. This is not a conspiracy theory. This is conspiracy history. Technocracy is a resource-based economic system intended to replace capitalism and free enterprise that emerged around 1932, rooted in the heat of the Depression. Significant technocratic movements developed in the 30s and 40s, but came to an end in World War II. Modern globalization efforts began in the 1970s, spearheaded by the Trilateral Commission created by the Carter administration. The objective was to create a new international economic order. Seeking the same goal today, technocracy has new names, including United Nations Agenda 21 and the 2030 Agenda, Smart Growth, Sustainable Development, the Green New Deal, all of which introduce a resource-based economic system. Klaus Schwab of the World Economic Forum calls it the Great Reset, which you hear echoed in Biden's agenda for the United States and the mouths of other world leaders of all varieties. To operate this new financial system, we must be digitized. Currently, central banks are setting up digital systems that will bring an end to fiat currencies around the world. This system will require a digital identity for every individual, which will track your personal history, your activities, and your future. This will be a total loss of privacy, with AI reviewing and predicting your behavior and intervening as necessary. Welcome to the future scientific dictatorship. Are you thinking conspiracy theory? Well, the global conspirators are meeting right now in Geneva, voting whether or not to strip the United States and 194 other nations of their health sovereignty and give the WHO total control over global health. Right here in Oregon now, people are getting their own digital identities through the vaccine passports. And the ineffective vaccines are still being pushed, just like LCPH does, in order to issue more passports. Disguised as a health-based protocol, these digital identities will take on greater significance as the global technocrats move towards a fully digital currency and human tracking system. If you take comfort that Oregon's digital passport system is voluntary, don't. This voluntary system is the proverbial camel's nose under the tent. The COVID pandemic, whether accidental or intentional, has provided the opportunity to execute what some are calling a coup d'etat of global technocrats. Want to learn more? Look up Patrick Wood, and his website, Technocracy News and Trends. The more you learn, the more you'll understand about what today's economic chaos and global health scares portend. Thank you.
Thank you for your public comment. Our next speaker is Dee Love, followed by Michael Gallardi. Dee, I will unmute your microphone and you may begin your public testimony.
Good morning, everyone. I hope you're well. Nice to see you back in person. I'll try to make it in someday. Thank you, Commissioner Jay, for bringing up the issue of human trafficking. George Washington stated, quote, "Truth will ultimately prevail when there is pains taken to bring it to light," end quote. My grandparents sailed from Italy to Latin America, where I was born, in search for life away from war. Life was great until it was violently stolen from us by corruption. I visited many countries and know people from Venezuela, Cuba, China, and we can assure you from our far and recent experience that overstepping governments turn nations into slaves. Poverty and crime take over, and it's terrifying. The United States is being pushed on that path. The states of California, Oregon, and Washington have become the hub for drug addicts and long-term homeless people from all over. Many have no interest in working. Some are even dangerous. They get food and services from the government. Meanwhile, all that funding is coming from our pockets, my pockets. When I look at the West Coast, I wonder, are we trying to solve homelessness or are we fostering it? Are we trying to solve drug addictions or are we openly flooding our streets with drugs? Commissioners, last year, I spent much time studying the Oregon COVID numbers from the source because I don't watch the corporate media. And I invested my energy into bringing you another perspective every week, asking questions. You express that you hear us. Please, if things get tight again with COVID or with the future issues, never lose ground of each individual's liberties and sovereignty. Coercion is bad in all ways that you look at it. If a pandemic with over 98% survival rate convinced so many people of injecting themselves repeatedly with an experimental short efficacy vaccine, what will they comply with next? What is your limit? The governor and OHA are dodging our questions, and they also charge about $10,000, because I asked for public records, when citizens ask for basic public records. If Brown version 2 gets into power next, this state will go from having communist tendencies to turning into communist land. I'd like to close with a little prayer. Sweet, precious, ancient emerald forest and deep, majestic ocean, guide us on the path to be good stewards for you, ourselves, each other, our dear home planet, and all beings. Clear us from the illusions that don't let us see. We hear and welcome the truth flowing through the wind, and we will act with good intentions, kindness, and love every step of the way. May humanity evolve. Blessed be. Thank you.
Thank you for your public comments. Our next speaker is Michael Gallardi, followed by David Ivo. Michael, I will unmute your microphone and you may begin your public comment.
Good morning. Can you hear me? Hello?
Yes, we can.
Good morning, commissioners. I'm Mike Gilardi. I'm here to talk about an item that was on your
I apologize, Mr. Michael, that was me. I'm going to unmute you again. Sorry about that. You could unmute your microphone. Mr. Gallardi, if you can hear me, there you go.
Okay,
sorry about that.
Sorry, folks.
I'm going to reset.
Okay, good morning again. I'm here to talk about an item that was on your agenda a couple of weeks ago about the county's local land use rules and how they compare to state law. I had hoped to speak to that a couple of weeks ago when you were considering this, but you didn't take comment at that particular meeting. So I thought I would take an opportunity to try to keep this on your radar. As background, I'm a real estate lawyer. I specialize in natural resource issues. I work throughout the Northwest, but I'm based here in Lane County. I grew up in rural Lane County and moved back here with my family several years ago. So I have some perspective on how what happens in the county compares to the rest of the state. And I'll say that, you know, Lane County, the land use system in Lane County is the most difficult to navigate anywhere in the state. There's more disputes, land use disputes in Lane County than anywhere in the state. More appeals come from Lane County than from the city of Portland, than from Washington or Clackamas counties, Deschutes County, anywhere. And a lot of this is due to the fact that the county just hasn't responded effectively to the decisions that the courts have made over the last several years. Exhibit A to this are the big game rules, which you heard about from Keir Miller. And I think the message in the staff report was, you know, it was framed as, are the county's rules more restrictive than state law? And I think the staff's response was no, and the Land Use Board of Appeals told us we need to be more restrictive.
It was.
With all due respect to the staff, that's not accurate. I mean, what happened is that the county set a policy 40 years ago that it never implemented. And so eventually LUBA called the county on that. And so I want to emphasize to you that, you know, these are your policies. You have the ability to change them. You know, Keir Miller testified that there are 6,500 F2 zoned parcels in the county with an average density of 22 acres. Now, I think a large percentage of those are not going to be able to be used in many ways because of these big game policies, unless you change them. Somewhat similar issue with legal lots. What's happening there is that the county is you know, going back and revisiting decisions that have been made over many years, decades. And in some cases, there's a good reason to do that, but in many cases, there's not. And what that's doing is that anytime someone comes in to get a new land use permit, there's a lot of uncertainty as to, you know, whether the county is going to recognize their property as lawful and what the process is going to look like to get whatever permit they're trying to get. And it's just creating a lot of sunk resources, public and private, a lot of dispute, and you can improve those rules. And
I do show our next speaker is David Eigel, and I do show that Mr. Eigel is our last speaker. So if you are wanting to present public comment and you have not spoken yet, please raise your virtual hand. Mr. Eigel, I will go ahead and unmute your microphone and you may begin your public comment. I do show yourself muted, Mr. Eigel.
Okay.
There you go.
I'm following up today with my information about the very sad situation at the Lane County History Museum. The Oregon Black Pioneers exhibit is so completely full of misinformation that it should either be closed or fact sheets need to be provided to the public who view the exhibit so that they may not be deceived. I've almost completed my documentation of many of the most dishonest and sleazy aspects of the Oregon Black Pioneers exhibit, in that the funding for the museum primarily comes from Lane County. The commissioners are ultimately responsible for this fiasco. I previously mentioned that visitors to the exhibit are informed that historically Blacks could not live in Eugene. Prominently displayed are information about a man named Wiley Griffin who lived and owned his own home in Eugene. Mr. Griffin was Black. This represents something other than honest scholarship. The pioneers failed to perform even basic research. They simply falsified their statements. Two quick additional examples. The exhibit boldly proclaims, while some have claimed that this 1920s reinvention of the Klan was more like a fraternal organization than a hate group, the historical record does not agree. No, wrong, 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 wrong. The Knights of the Ku Klux Klan Fraternal Order was more than like a fraternal organization. It was a national fraternal order, not a group of violent vigilantes. It was incorporated in Georgia in 1915 by William Simmons. He personally owned the copyrights of its rituals and regalia. And another statement, newspapers in Eugene, which were controlled by Klan members, were largely silent on the issue, instead running advertisements on the benefits of Klan membership. This is the opposite of the truth. Both of the Eugene papers editorialized against the Klan. Charles Fisher, the Eugene Guard's editor and controlling shareholder, was one of the strongest anti-Klan editors in the state. The research I have produced represents years of my life. Please review it. I've tried to keep it succinct to be respectful of your time. Thank you.
Thank you for your public comment. At this time, I do not see any additional hands raised for public comment, so I will return the meeting to you, Chair Farr.
Thank you, Ms. Jones, for handling the online comments. We do have a queue in Harris Hall right now, beginning with Alan McWayne. And Alan McWayne will be followed by Kim Morrison if Kim Morrison has rejoined us. Alan McWayne.
Good morning. I'll take off my mute here. I've been to a lot of meetings in Harris Hall over the years and never seen it quite this empty. And I realize the time is just zooming by. There's no way I can get through all of my list of notes, so I'm just going to summarize and dash through. I'm here to address the issue of the LEC proposed venue for the M's. I know there's going to be a lot of later city hearings dealing with traffic and noise and parking and all that, but I wanted to deal with 4 main issues: funding, size, public land, and whether the M's have local autonomy. As far as funding, I've been to so many meetings, city club, neighborhood meetings, fairgrounds, read everything published on radio, TV, and the assertion was always that the M's would pay $10 million for the stadium. And finally, your own Austin Ramirez, the economic manager, mentioned that that is actually their operating lease. So that will not go to the construction of the stadium. So many M's fans are saying we really need to take this opportunity. The M's will pay for it. TRT will pay for the rest of it, but I think it's not quite that simple. As far as size, first it started at 5 acres, then 6 acres, then 7.6 in the county submission to the state legislature. And finally, the last article in the RG is 9 acres. I think that the actual perimeter of the stadium is going to be a lot bigger, and with setbacks and buffers. As far as being on public land, the other choices were Airport Road, Chad Drive, Glenwood, Junction City, Prairie Road. The attraction for the AMs of the LEC is that the county and state will pay for it. However, the parent group of the AMs does own 7 other teams. 4 of those are in owner-operator situations. As far as being local, AMs are owned by ESG, Elmore Sports Group, a large conglomerate with 130 teams or other businesses. It owns 7 teams, and in 2019, 3 of those teams were moved out of their hometowns, from Helena, Montana to Colorado to Texas. And finally, this is interesting, Ball-Yard Incorporated some years ago, ESG approached Northampton County with a $10 million offer to build a stadium there, and that never occurred because it was in violation of the Phillies sort of territorial contract. And I'm almost out of time, and I should submit these in writing later. Thank you.
Thank you, Mr. McWayne. That concludes public testimony today. I understand that Kim Marson has not rejoined us for public testimony. That's the conclusion of public testimony. And Mr. McWayne, you can submit anything in writing that will be considered for the next board meeting's public testimony as written testimony. We'll move along directly then to item 5 on our agenda, which is Commissioner's response to public comments and or other issues and remonstrance. We do have a 10:30 time certain, so we do have time for Commissioner's response. So I have a queue. Commissioner Buck.
Thank you, Chair. I appreciate everybody who was willing to go through this new hybrid version of our public comment today. I think for overall, it's gone smoothly so far. I want to pick just one to talk about, and that's regarding the land use law and big game. We've been talking about this for several meetings so far, and it is clear that from the board, it seems that we've got unanimous, input that we want to find a solution right away. So I have been reading additional comments that come in as they do periodically, and appreciate people coming in to testify. We do take it very seriously, and we are looking at a variety of options in order to move some corrective land use forward in order to solve this issue. Thank you, Chair.
Thank you, Commissioner. Excuse me. Moving along. Commissioner Bozovich.
Thank you, Chair. First, just to Mr. McWayne and others, we have been reading the emails, and I did receive your public testimony that was already submitted in writing, and am paying close attention to the public's input on the LEC. I want to spend a minute, though, just to note the passing of former Sheriff Tom Turner. This is our first meeting since then. Tom was an amazing person, a great family man, a longtime public servant in this community, from Eugene Police to Lane County to the city of Florence as police chief. He will be missed, and I just want to say he was a key person in the passing of our public safety levy, the first levy to pass in Lane County in a generation and 14 tries. And my partnership with him on working on that levy allowed me to get to know Tom as a person and just a stand-up person. So he'll be missed in this community.
Thank you for mentioning former Sheriff Turner. Vice Chair Trieger.
Thank you, Chair. I will just also echo the appreciation of everyone taking part in this experiment with us of the hybrid meeting, and really glad that we can offer it. I think it makes our meetings much more accessible and allows people to contribute in the way that works best for them. I also have been reading all of the emails that come in on the stadium project, and I'm just looking forward to our 10:30 item, because I think that will provide some clarity. And mostly what I'm really looking forward to is the opportunity to give clarity to the community about where we are in this process and what decisions have or have not been made, and what information we still need to gather to make the best possible decision on behalf of the community and to steward our resources here at Lane County.
Thank you, Vice Chair Trieger. I'll take a few moments. Ms. Morgrassi, just a reminder that Commissioner Burney is not with us, excused absent today, as well, there are only 4 of us up here today. First, in response to statement by Mr. Velarde, Mike Velarde, and I apologize for the messing up of the name, I didn't see it written. You mentioned that Lane County is the most difficult land use to navigate because of, you cited more appeals and more disputes than anywhere else in the state. The appeals and disputes really aren't we don't generate those, we receive them. And it is a fact, and our land use staff has noted that we do receive more appeals and more disputes than any other county in the state. And it's because we have a very active group that tends to appeal a pretty broad range of land use issues outside of the urban growth boundary. A member of that group, I believe it was, wrote over the weekend that the true way to stop land use issues in Lane County, and I'm paraphrasing, is to stop population growth. Unfortunately, we don't have an opportunity in Lane County to stop population growth, but this is their method to attempt to stop population growth. It would seem, based upon a letter in the Register Guard over the weekend, that land use disputes will stop population growth. I'd like to hear more about that. The other thing I'd like to point out is that we are looking through the back windows of Harris Hall for the first time in 2 years, and we have something new out there. Oh my gosh, instead of the old Butterfly parking lot and then the construction that took place after that, we do see the new Lane County Farmers Market building, which I believe has its operational opening this weekend. Is that right?
I think next, I think June, first Saturday in June.
The first Saturday in June, okay, thank you for that. But it really is a beautiful building. I like the site of it, and I'm very excited to see what is going to be a year-round farmers market right here in the center and heart of Lane County, right opposite the courthouse, on former Lane County property, which is a part of a land use swap with the city of Eugene. So, Ms. Mokraski, thank you for the work on that. Thank you for the staff. I have a picture of you when we're signing the documents for that, for the land use change 6 years ago now, 5 years ago perhaps. So, good work. I'm excited to see produce being sold in front of the courthouse year-round. With that, Mr. Mokraski, we'll move along to our consent calendar. We do have before us item 6 on the agenda, which is our consent calendar. The consent calendar is considered to be routine by the Board of Commissioners and will be enacted by a single motion. There will be no separate discussion of any of the items. If discussion had been desired, Commissioners would have had an opportunity to pull individual items from the consent calendar. So, Board, we do have before us the consent calendar. Do I have a motion?
Chair, I'll move passage of consent calendar for Tuesday, May 24th, 2022.
Moved by, seconded. Moved by, I'm sorry.
Before a second, I just want to declare a potential conflict of interest. A couple of items in the consent calendar have to do with the LCOG, the Lane Council of Governments. I want to remind the board that I am the representative from our board on the Council of Governments. I am now the chair of the Council of Governments, but I always come to that particular board with county as first and foremost on my mind. I don't think it's an actual conflict of interest. I just want to make sure that that's stated. And with that, I'll second.
Thank you for the second and the declaration, Commissioner Buck. Moved by Vice Chair Trieger, seconded by Commissioner Buck. Discussion to the motion. I see no discussion. I'm going to call for the vote. All those in favor, please say aye.
Aye.
Aye. Passes 4-0 with Commissioner Burney excused absent. Moving directly along, we are a little bit early for the time certain, Ms. Mokraski, so we could step to county administration announcements if you want to provide a few moments of announcements, and then we'll come back to that.
And I can give you a brief elections update. I don't have an update today from our clerk. Sorry, I was just going to look, but I can do that again later today. I don't believe the county council has any updates. Let's see, the elections team is, we're actually, Lauren is here. Do you want to do the update, or do you want? No, okay. I was looking for a message from Lauren, who shared with me yesterday that the elections team is working to complete all the required work accurately and as completely as possible this week, including adjudications and placeholder ballots. Our goal is to try to provide an update as of there's a 7-day window from the day of, from election day, which was last Tuesday, through today, where mail-in ballots still count. So the ballots that we receive, mail-in ballots that we receive through today will count. And so we'll process those. And if we're able to confidently complete all of that work, it's possible that we can provide an update by tomorrow or Thursday in advance of what we've committed to is Friday, end of day Friday, to provide the next update. But we'll do that as soon as we have more information. So that's where we're at on elections. That's all the update I have, Chair. If we don't have any other business, you're certainly welcome to recess for 5 minutes, take a quick break, and then we can jump right into the time certain at 10:30.
Let's recess in place then for say 3 minutes, and in the meantime, feel free to assemble the panel for the time certain. At 10:30, we'll begin the time certain, which is a report in the matter of reporting the proposed Lane Event Center multi-use community facility and delegating authority to the county administrator to amend contracts with International Facilities Group LLC and Goldfarb and Lippman. So in about 3 minutes, I'll nod us back in, but we'll just recess in place. Take a moment to look at your emails or whatever you may have to do in place.
Yeah.
Stand up and stretch. We're still on camera. We're still live, and so don't sing out loud. right now, so we're gathering to begin our 10:30 time certain. The clock on the wall, you'll notice, is a minute fast. It's actually 10:27 right now, not 10:29. Then, Ms. Mokrowski, we are a few moments early, but I think let's begin the preamble to our 10:30 time certain, which is County Administration, item 8A, which is in the matter of reporting on the proposed Lane Event Center multi-use community facility and delegating authority to the County Administrator to amend contracts with International Facilities Group, LLC, Goldfarb and Lippman, LLP. And Ms. Mokrowski, Ms. Mokrowski, I'll let you introduce your local panel, but I do understand this is a hybrid meeting, and we do have a number of panelists who are joining us via hybrid. And I'd like to first personally say hello to DG Elmers. Wish you could be here today. I understand that you're not, but I enjoyed watching an M's game with you not too long ago. Actually, it seems like forever ago, doesn't it? To amend contracts with International Facilities Group, LLC, Goldfarb and Lippman, LLP. And Ms. Mokrowski, I'll let you introduce your local panel, but I do understand this is a hybrid meeting, and we do have a number of panelists who are joining us via hybrid. And I'd like to first personally say hello to DG Elmers. Wish you could be here.
Why don't we ask anyone who's on screen if you could turn your mic off.
Actually, it seemed like forever ago, doesn't it? To amend contracts with
see if that works.
Group, LLC, Goldfarb and Lippman, LLP. And that's my voice, isn't it? I'll let you introduce your local panel, but I do understand this is a hybrid meeting, and we do have a number of panelists who are joining us via hybrid. And I'd like to first personally say hello to DG Elmers.
Actually, why don't we ask?
There we go.
There we go. All right. Thank you for
Mr. Mokrowski.
As you shared, Chair, we are working out the bugs in this hybrid environment. It actually has gone pretty well today, so we're learning some of these things as we go. We've got a great team of folks here this morning. We have about 90 minutes scheduled for you. I'm not going to take too much time to do the introductions. Lauren Blythe, our interim Director of Operations, is going to do the run of show. Lauren has taken over as the point person from Lane County, leading this effort, but we have a great team here of county staff. Corey Buller, of course, our Lane Event Center manager, Sean Waite, our facilities manager, and several other staff here. Lauren is going to go through and introduce folks. We also have representatives, our consultants that we are working with, that are with us virtually, as well as representatives from the M's. And what I want to just do is set the stage for what our intent here today is, and that really is to provide an update to the Board of Commissioners on the work that has happened to date. We do have a couple action items, and those items will be to approve contracts moving forward with consultants if the board wishes to continue this work. We do plan a significant amount of continued public engagement. What I want to just do is a number of meetings with neighborhood. We've had a number of meetings with neighborhood groups and the broader community. We will continue that work if the board desires to move forward here. I think everyone understands the tight timeline that we have. And so it's the balancing act of moving forward and making sure that we capture every opportunity to advance this project if there is the desire and the will to do that, but also make sure that we're informing the board and the public about the various options. And we've had a number of meetings with neighborhood. All right. Yeah. So So we're going to walk through, and you're going to hear from both county staff and representatives from the M's here today. The decisions will be regarding approval of contracts to continue this work, contracts with our consultants to continue this work, but there will be additional meetings for further decisions down the road that the board will need to contemplate. So I just want to be clear that, one, there's going to be a significant amount of continued public engagement and feedback that we will seek. There's a lot of work that needs to be done related to options for funding the totality of the project. There's a lot of work that would need to be done related to design and engagement with the community around the design and impacts of a facility, and as well as agreements and other things. So a lot of work ahead, and I want to turn it over to Lauren to walk through the work that has been done to date and introduce you to the folks that we have available here to answer questions. Thank you.
Thank you, Steve. As Steve indicated, with us today on the Lane County team, we have Corey Buller. I'm Lauren Blythe, Interim Director of Operations. We have Corey Buller, Lane Event Center Manager, Sean Waite, Capital Improvements Manager. Also presenting briefly with us this morning is Christine Moody, Budget Manager, and also available for the discussion section are Alex Kyler, Jim Cheney, and perhaps others. Also with us, as Steve mentioned, are our partners, the Eugene Emeralds. With us online, we have DJ Elmore, Gant Elmore, and Alan Benavides, General Manager of the Eugene Emeralds. And also online, we have our consultants with us from International Facilities Group. It's Mark Appel and Phil Couture, and Thomas Weber with Goldfarb and Lippman. So today, just to reiterate, our purpose today is to provide a report on the progress that's been made since the board was presented with the initial proposal of this project back in December, which is in the assessment of the feasibility of a multi-use community facility at the Lane Events Center with the M's as the anchor tenant, and to request your direction in continuing this assessment and including delegation of authority to the county administrator to amend the existing contracts with the consultants. This is an iterative step in the process, and no significant decisions have been made yet. So with that, I would like to give a brief update on some of the progress to date since December. In January, the Lane Event Center Master Plan consultants engaged with Turner Construction Company, a nationwide leader in construction services. Turner provided a high-end estimate that came in at $78 million for a multi-use facility and baseball stadium. That estimate included adjustments for time and locale, which were not previously considered. The consultant qualified that analysis as it being high-end for a facility larger than what is needed and envisioned at the Lane Event Center. So I want to be clear that is not what we think is in mind for this project. Their qualification indicated that $54 to $67 million was a reasonable range. And so we agree that this was on the high end and confident it can be done for less. The consultants and the ends will speak to that later. In February, a high-level concept was provided by Master Plan consultants and used for the legislative funding request. In early March, the Oregon legislature allocated $7.5 million in funding towards a multi-use facility at the Lane Event Center. Later in March, we began early engagement with the consultants, International Facilities Group and Goldfarb Lippman. And in April, they began early drafts of key documents that are commonly used for or utilized in a project such as like this, including furniture, fixtures, and equipment. You'll hear FFE, and which details which party is responsible for which aspects of the facility, as well as an exclusive negotiating agreement that detailed the relationship between Lane County and the Emeralds, and the consultants will elaborate on these items as well. In April, we initiated an environmental study to do some preliminary checks for any considerations of hazards that might be in or under the soil, similar to the study that was conducted for the Keystone, I believe it's called, the Keystone housing just adjacent to this location. So those were kind of the key progress points that have been made. Again, no hard decisions have been made. We are still in the feasibility phase of this, and this next phase would essentially continue that with more earnest engagement with the community and additional steps to bring back to the board for further direction in the future. With that, I would like to turn it over to the M's, plus Corey and Sean for additional information. And I think we're starting with EG.
Thank you, Mr. Blythe. And if you step to the mic, more than one person can cluster around the mic if you wish to, and just speak directly into it. Welcome.
Thank you. This is DG Elmore. I'll be speaking to you. I apologize for contracting COVID the other day, and so I wasn't able to make the trip, but we're fortunate to have my son Gant Elmore there. He's third generation of the Elmores owning and managing professional baseball teams. And he's, I think it's particularly appropriate for him to be there because as we think about the building of this new facility, it's something that's going to be lasting way beyond my lifetime and will be something that will be very much part of his life. And so, Gant, I'll turn it over to you.
Thanks, Dad. And Chair Farr and Commissioners, thanks for having us here today. Just a couple of things that we wanted to highlight as we think about going down this path. We're excited to be the anchor tenant in a new multi-use community facility at the Lane Event Center. It would allow professional baseball to stay in Eugene and Lane County for decades to come. And it's been here for a long time. We've been a part of it for a long time, and we're excited to continue to be a part of it going forward. In addition to baseball, we see the multi-use facility hosting dozens of other events in conjunction with the team at the Lane Event Center. These events, we desire to have concerts and nonprofit fundraisers, holiday events like haunted houses and holiday light shows to really bring the community together, bring Eugene together, and bring people in from outside of the community in the county to the event center. Our commitment to Lane County to help make this happen includes $10 million for this facility. We want to be a real part of making it a thing that the community gets to enjoy for decades to come. In addition, we engaged the lobbyists to help us get the $7.5 million in state funding and are working on an additional $1.5 million in federal funds for the facility. And we've recently agreed to share in partnership with the county, the costs of some of the early architecture work this summer as a step to move this project forward on the timeline. And lastly, we've started having a good faith and equitable discussions on the required operational and lease agreements and look forward to continuing those with Thomas Weber and the county as this moves forward.
Thank you, Commissioners. Alan Benavides, General Manager of the Emeralds. Thanks for the opportunity to explore this, again, multi-use facility at the Lane Event Center. You know, we've made great progress with IFG. They've been wonderful to work with and talking about, you know, what this could possibly look like. And the county staff has been tremendous. As I've mentioned, the situation at PK Park, it really is only manageable for us for the short term. I just want to really make sure that is loud and clear because the university would prefer to have the Emeralds have our stadium situation figured out by 2024. The overlap in schedules is difficult, but also the Major League Baseball requirements at the facility aren't up to par. And so it is very, very short term for us. The Major League facility requirements deadline is 2025, but like I said, the university would like us out much earlier, but they are working with us and have been a good partner to that extent. We have searched far and wide for a suitable location, and for multiple reasons, the Lane Event Center is the most desirable site we've researched. And for the past year and a half, I've engaged in dozens of public forums to discuss the current dysfunctional situation we are in. As we continue to engage with Jefferson Westside and with folks who are for and against the project. We've had a lot of people for the project, and we've got people against the project. I've spoken with Alan and Christine and other folks who are against the project and have concerns, and I think they're really valid concerns, but we will continue to engage and have conversations on how we can mitigate these concerns with the community. And since becoming the GM in 2010, I've always put the community first, and we do that year round. I'll continue this model of community engagement in building this facility and afterwards to ensure that we are a good community leader and we work with organizations in the neighborhood to make this a lively and fun facility. Thanks again for the opportunity. We very much look forward to working with county staff, the Lane Event Center, to make this a jewel for Lane County.
Thank you, Alan. Mark and Phil? 2.5 minutes. Hear you. They're still listening to Gant. Thank you, Alan. Mark and Bill?
Hello, apologize. We feel like we're on a tape delay of a couple of seconds. I hope this doesn't hurt our presentation, but first of all, Phil Couture and Mark Appel, we are the majority owners of IFG, International Facilities Group. First thing, I'd like to thank you all for the opportunity to be here to work on this project. And it's been great to work with the outstanding professionals from Lane County and the Emeralds. And you really have a good team here.
Mark and Bill?
Hello, apologize. We feel like we're on a tape delay of a couple of seconds. I hope this doesn't hurt our presentation. First of all, Phil Couture and Mark Appel. Opportunity to be here to work on this project, and it's been great to work with the outstanding professionals from Lane County and the Emerald. And you really have a good team here. Just like to talk a few seconds about IFG. I feel like we're on a tape delay of a couple of seconds. I hope this doesn't hurt our presentation.
You might turn your speakers down.
Maybe we'll dial in.
Okay, here we go.
Opportunity to be here, work on this project, and it's been great to work with the outstanding professionals.
Is your webcast on?
I think really have a good team. Oh, I don't know.
Yeah.
Just like to talk a few.
Give us 1 second.
Hi, this is Diana. I'm going to interrupt for a second.
Is this better?
Mark and Phil both logged in under the same logins. I think you guys are clobbering each other with your audio.
We'll log out and log back in.
Yeah, and just log into one of them, and that should help. Thanks.
Yeah, I think for the sake of time, we can move to Goldfarb and Lippman. We have Thomas Weber.
Good morning, Commissioners. My name is Tom Weber. I'm with Goldfarb and Lippman, and we primarily represent public agencies and large development projects and nonprofit housing projects. So Phil and Mark, we jump to me. We'll come back to you. Okay, I guess. My primary role will be to assist staff in structuring and documenting the transaction.
They're talking now, we can't hear
them. And the first step will be to finalize an exclusive negotiating agreement, or MOU. Lauren referred to that. We've drafted a draft exclusive that staff is looking at internally. The exclusive basically outlines the broad business terms of the transaction. and it typically addresses each party's responsibilities in the design, ownership, construction, financing of the transaction, and operation of the project. Once the staff, and this is important, once the staff and the M's come up with their basic agreement, the exclusive will come back to you for your consideration and review. And if you decide to move on with the process, the next steps will be negotiating and drafting the definitive documents. These will include a DDA, a lease, an operations and maintenance agreement, among probably a bunch of other documents. The DDA will spell out the details of the roles and obligations of the parties in relation to the development of the facility. So for example, the DDA will allocate between the parties various financing responsibilities, how decisions about the design and construction will be made, conditions that will have to be met before entering into an agreement with the M's. And typically DDAs include a scope of work, a schedule of performance, and a financing plan. We would draft a lease that would be an attachment to the DDA, and that would, again, kind of outline what the M's responsibilities would be as a tenant to the facility. We're thinking of an operations and maintenance plan where the parties will agree on how to manage the facility and how they'll cooperate in doing the year-round programming of the facilities. And again, the final drafts of the DDA and the other definitive documents will be presented to Board of Commissioners for your, again, consideration and approval, hopefully. So that's really a very high level overview of the process that would be taking in documenting the transaction. I know Phil and Mark are going to talk to you about sort of the nitty gritty of how to develop the facility. And, if you keep in mind that when you hear these guys talk about all the details, these are the details that we'll need to build into the document. So people who aren't as familiar with the transaction can pick up the documents and everybody understands, again, who is supposed to do what. For each step of the way, for the exclusive, for the other documents, we'll be coming back to you and have a much more in-depth discussion than I just gave you on the documents. And I will be available for any questions after the presentation. Thank you.
Thank you, Tom. Mark and Phil?
Yeah, apologize for that. I will just give you 1 minute the background on IFG, and then Mark will talk more in depth on the project. We provided owners representation services for the professional sports industry, the public and private clients for more than 25 years, which represents about in excess of 40 professional sports projects. About half these projects are public sector clients, which include states, counties, municipality, sports authorities. Several times we've even represented both sides, the club and the public partner. Related to baseball experience, we've worked on 10 major league ballparks, 8 minor league spring training facilities. Most recently, Southwest University Park in El Paso, Texas, Riverfront Stadium, AAA, Wichita, Kansas, Polar Park in Worcester, Massachusetts, and the Brewers spring training, which included significant player development facilities. And they have about 200 prospects there at any given time. So we're very experienced with this type of facility and look forward to working with you.
Yeah, I'm Mark Appel. I'm Phil's partner, been at IFG for about 25 years. Worked on a lot of ballparks, and I'm going to start with, we often refer to the multi-use facilities as ballparks because we just like the word ballpark. It just sounds right. So I apologize in advance, but we think of all ballparks and sports facilities being multi-use. And our experience from Salvation Army projects we've done here in Chicago recently, we've actually incorporated a lot of emergency use provisions into those facilities. So We think of these as community facilities, and I apologize if we say ballpark when we mean to say multi-use facility. Just very briefly, there's been a lot of detailed discussions, a lot of iterations of things that we've gone back and forth on. But the first and foremost, we're thinking that it's still very possible to build and open the ballpark by the spring of 2024. I know that meets the team's goals, and we think it's possible, but there's no time to waste. So we need to move quickly to do that, and we need to, get everything in shape to complete that. In order to, and the other thing I'll say is that sports projects are unique buildings, and that the approach that people use on these varies a lot project to project. So one of the first things that we do when we get involved in a project is we just try to sort things out and make sure we're all on the same page. And Lauren and Tom both alluded to one of the documents we've worked on, very detailed document where we list all the pieces, building components and equipment, and we go through it with the M's and Corey and the folks in Lane County, and we talk in detail about who's going to design which element, who's going to procure it, who's going to pay for it, who's going to install it. That responsibility matrix is very important so that we don't end up with this someplace down the line and have real disruption. So that document that we've worked through would be attached to a lot of these different agreements. So that, again, everybody gets on the same page early. A lot of work goes into it. The NEMs have been great to work with on it. The next thing we do is we really focus on what is the ballpark? Multi-use facility. We use a preliminary program document, which is a tabular document. It's a lot more detailed than typically is done at a project at this stage. But what we like about it is it really, we really do a lot of mining for the most important things to the team, like, how many seats they want and what area of the ballpark. And what we do with this is we then use this tool to generate building areas, and then we calculate and project the overall building area. I'm blowing over a very detailed document, lots of discussions on this, but we like to be able to project the overall building area and compare that to other similar buildings to see if we're on track. Now, once we've created this document, we'll hand it to our design professionals when they come on board, and they will continue to refine it. But just as importantly, what we will ask them to do during the design process is account for every single space as they doing the design. So we compare what the design is compared to what we asked for. And we put a delta line, and that keeps us on track. Or if we're under or we're over, we didn't focus on that. So we've been working on that, a lot of back and forth. The other thing we've worked on with staff and the local construction industry is talking about what is the best design and construction delivery approach. Design, bid, build is the traditional approach. You hire an architect, they put together documents, you bid it out, you take bids, and away you go. That is rarely used in these unique buildings. And there's a reason why. Because they're so unique, it's hard for the architects, the engineering community to have good cost information. So more often than not, and we use either construction manager approach and more recently design build approach, where we partner with builders during the design process. So we're getting real-time cost and constructability input. And that's important on every project. And I think it's even more important today with the kind of environment we're in. And so we are recommending, as a result of our discussions internally and with the construction industry, that we pursue a design build approach. And we know that in order to do that in Lane County, we have to seek an exemption to utilize one of those two approaches, design build approach preferred, and that process I think is already underway. Now, I think Sean may be able to offer a little bit more about that process and some of the steps that we're going to go through. So thank you for the time.
All right, thank you, Chair Farr, Commissioners. So as far as we talked a little bit about the procurement method of the design build, depending on the board's decision today about if we're moving forward, we will be back in front of the board on June 15th to discuss the actual procurement process and seek your approval to move forward at that time. So we don't want to spend a lot of time today going into the details. If we are directed to move forward with the process, then we will be back on the 15th to discuss the procurement process in detail.
Okay, so I'll take the next piece here and keep it brief. Just a reminder, kind of why we're here. Thank you, Chair and Commissioners, for your time. As you know, we've been engaged with a group of consultants regarding our master plan. That's been an ongoing project for quite a few years and is finally gaining some headway recently. We're ready to re-engage with them for the overall plan with the fairgrounds, including this opportunity. I anticipate they're either watching or will be reviewing this and getting ready to re-engage. But as a reminder, one of our main goals throughout this whole process has been to revitalize the campus, be a part of the neighborhood and downtown as a destination site for years into the future. So we're looking forward to a very robust public engagement process, not only on planning activities and programming around this building, but in a whole for the whole rest of the facility as well. We anticipate working with the neighbors and others to identify mitigating impacts or concerns throughout this design and program process. We found out already through multiple engagements that there are some concerns, and that's okay. We'd rather know about them now in advance before we get too far down the road. But what we have found out is that many of them can't be addressed until we do get further down the road and either get some work done or some pre-design done, because that's when some of those efforts can be put into place. So we're excited to work with the team. I'm glad to see the representation from the team and the M's here. We're going to look at ways to maximize the programming, the usage of the facility, making sure that we don't negatively impact the other events and other activities that are already currently happening on the fairgrounds. And as a reminder, multi-use and flexibility, those are words that we're going to continue to use and will for the future. They're a key component for all of our facilities moving forward. When we provide opportunities for entertainment, business, emergency response, you name it, multi-use and flexibility are those key components that allow us to do those on separate weekends at different times and sometimes even at the same time. So this potential facility can provide space for all those activities. It can also act as a guide and catalyst for additional improvements and that master plan as we move forward. So as an enterprise fund that works with and supports the travel industry, we're excited about this potential and any others that will be identified in the master plan. I look forward to bringing that back to you in the near future. Thanks.
And Christine to speak to the funding aspect.
Thank you, Chair Farr, Commissioners. So as you've heard some of the numbers, and in your memo, we've detailed some of the funding options that have been identified so far. I think what I want to highlight for you today is just that there will be obviously some multiple funding pieces. This will be pieces of the puzzle, if you will. And the pieces that I would highlight is that in the memo, we've identified some cash that we have up front from the state legislature. We've also identified money that we have over time. So there is the anticipation that the county will incur debt. We'll take out a bond to pay this, and then we'd use these different funding sources to pay those amounts over the 20 years. We're also, of course, paying close attention to operating costs, as has been mentioned, to make sure that we are able to maintain the facility. And then finally, I'll just mention the piece about the contract amendments that you're signing. The funding for those has been identified as video lottery. The commissioners will remember you just heard a little bit during Budget Committee about the infrastructure video lottery that's set aside. So those would be the funding available for those pieces. Thank you.
Thank you, Christine. So in summary, should the board direct staff, Lane County staff, to continue assessing the feasibility of this project and remain on track with the timeline, the next step for staff would include continuing to explore additional funding options, including existing resources, new resources, and partner contributions. This would establish a budget for which we can build to and operate from. We would also continue to work with the Emerald's ownership and consultants to finalize the terms related to cost, revenue, and facility programming. We would anticipate a return to the board on June 15th, as Sean indicated, to speak to the design build procurement process. And to be clear, this is not to begin construction. This is simply for the early design of the facility and to get a clearer picture of cost, footprint, and amenities, et cetera. Very critically, or very important, is in this next phase would be in-depth community engagement. As it's been indicated, we take this very seriously, and so engaging with the community to identify concerns and ideas and options around mitigating any of those concerns. Besides 15th of June, we do anticipate coming back to the board in July or August in such time as we have additional information regarding the funding options, community engagement findings, and additional information for the board and would seek additional direction at that time.
Mr. Morkowski, Mr. Blythe, thank you very much for the presentation, and thanks everybody for the presentation. I'm going to open the queue for discussion and questions from the board. And to the board, we have before us, if you look at today's agenda packet, you'll go down to item 3G, which is alternatives and options. And the alternatives are to direct staff to continue to work toward the feasibility of construction of a multi-use facility at the Lane Event Center with the Eugene Emeralds as the anchor tenant, including continue to explore additional funding and work with the Eugene Emeralds ownership and consultants to finalize terms related to costs, et cetera. We have before us an order which is order number 22052406, which is also contained in the agenda packet. With that, board, I'll open the queue for questions to anyone in the panel. So, beginning with Commissioner Bozovich. Thank you.
Thank you. So, over the close to 12 years I've been a commissioner, we've had a lot of stop-start about master planning for LEC, and at some points, even prior to my being a commissioner, there was discussion of shutting it down because it wasn't a financially viable entity, having been made an enterprise fund. Fortunately, we've been able to keep it financially viable. But one of the challenges to running an event center fairgrounds for a county is just to keep it financially viable. And you know, one of the reasons I'm interested in this project is it may be that piece that keeps that facility running. So I was hoping maybe Corey, if you could maybe talk a little bit about some of the fiscal impact of the LEC on this community and what time of year that impact happens, because I think a lot of our events are held in the winter, whether it's the home show or holiday market and shoulder months. But those wouldn't happen if we didn't have a financially viable events center and fairgrounds. You know, if we end up having to shut it down, we lose those events too that are shoulder month events. But I also understand that this facility is going to include some kitchen facilities and shower facilities that may actually assist those other events that happen in other buildings. So if you could just kind of maybe do a little bit of, you know, what's the economic impact of the community of the event center, the time of year that happens, and then maybe how this facility can fit in and support the overall health of the event center and even shoulder month events that happen in other buildings on the fairgrounds.
Sure, I'll take a crack at it. So we do have, you know, approximately 18 rentable spaces. We also rent the parking lot. We'll get as creative as we can. We'll rent just about anything we can. But in terms of kind of our season, yeah, this was an interesting opportunity because essentially from about October to end of April, the convention center is booked every weekend. In fact, there's multiple events sometimes that are happening on the same weekend. We're moving in, we're moving out. Sometimes we have night shifts that come in and rotate things over, and we have to push into the middle of the week or whatever. So it's not uncommon for us to turn business away during the wintertime. We're extremely busy, and we wish we had more additional space. Where we have found historically a difficult time to schedule things is in the middle of the summer. That's when people are using our wonderful parks and going and traveling and doing other things. This would be an opportunity, and on the face of it, even the use of it as a baseball stadium during that time still supports other activities because it bleeds into the other things that are going on. So when you talk about potential and discussing opportunities of other things that can happen, you can start looking at food truck events and things that could be happening at the same time, and how that could support people that are coming to the game could come and spend time at a food truck before going to the game or something like that. We have other events that utilize the parking lot for certain events that could use some additional space for exactly what you're talking about, and that's preparing food or storing things or working on it. In terms of the facility itself, I see it as a benefit not only to itself and what it can handle in banquets and graduations and those types of things, but there are current events that are on site, like the logging conference, that might find additional space within that area to be able to utilize it to, help their event grow. And that has been growing for the last 2 years. Luckily we came out of COVID and events are doing quite well. So we're very pleased with the number that we have, but space is becoming an issue. So when we do turn people away, we do need additional space.
I look forward to watching the two-man bucksaw contest in the stadium.
Yeah. Big audience watching that. Commissioner Wozniak, thank you. Commissioner Buck.
Thank you, Chair. I have a couple of questions first that have been presented from the public because they are emailing in to the commissioners weekly. And so I just want to clarify this for myself and for the public. First, they're wondering why the price jumped so much. Is it because the stadium got bigger? Or is it because there's additional features that we didn't take into account the first time? What is it that caused the jump specifically?
Commissioner, I'll take a stab at that and welcome the rest of my team to fill in any blanks. So the initial estimate of $45 million that was provided in December, as I understand it, was for hard costs, and it was based on a comparative analysis of similar stadiums, but for a time period of about 12 years, going back to, I think, 2009 or 2010. The analysis that was done in January was adjusted both for time and for locale. So the December analysis was not adjusted for construction costs and labor costs in the Pacific Northwest region. And the January analysis, besides those adjustments, also included the soft costs. In terms of the size and the footprint and amenities of the stadium, no decisions have been made on that. There have been numbers thrown about, but as Corey indicated and others indicated, the next phase for contracting with a design build contractor and entering that early design phase is what will flesh out those decisions and affect costs, but while we work towards solidifying a budget that then we will build to and operate from. Is there anything I missed in terms of the?
Maybe just one piece that I also should have highlighted for the board, and this is for the public then as well, is they will hear higher numbers from us because of the interest that we will have to pay taking out debt. So that's not what Lauren is talking about right now with the cost of the facility, but as we move forward, there will be higher numbers because we'll be talking about how much we have to finance, and there's interest in those amounts over the 20 years. So just kind of to keep that in people's mind as we go forward.
Thank you, I appreciate that. One of the other questions is coming up is surrounds parking and neighborhoods around being concerned that people, in order to avoid additional fees, or maybe it's closer to home, that they park in the community surrounding the fairgrounds, which I will note, I used to live next to the fairgrounds, and that happened all the time anyway, especially during the fair. But it wasn't, it wasn't potentially all year or 10 months out of the year in which games will be playing. So what can we do to alleviate concerns surrounding parking for the neighborhood?
Again, well, I know one thing, Commissioner, thank you for the question. One of the things we would like to do in this next phase is conduct a traffic analysis or traffic study to identify and flesh out what options there might be within that. Corey? Yeah, in addition, we do have over 2,000 parking spots already on site. And I think part of that master plan, especially if this multi-use facility gets incorporated, would be looking at additional, parking availability within our own footprint, seeing if we can improve some of that, and then working with the team. So making sure that we're collaboratively working together and scheduling that anytime that they have games, that we're also not putting, an extremely large event going on to where we're going to overfill all of our parking lots and spill out into the neighborhood. So working collaboratively, I think, will help in that as well.
Is there any discussion on traffic in association with LTD to accommodate more public transportation needs to the facility?
I think everything will be on the table. I mean, luckily we're off of 13th Avenue. We have multiple bus stops already. And as we talk about this potential facility as well as our master plan, we may be looking at, a change to our ingress and egress out of the grounds. So that plus drop-off zones, bus stops, pedestrian, bicycle areas, I think will all be incorporated.
Appreciate that. One of the things that I'm looking for ultimately as we move along, and if we're able to get to a point in which we're able, to start, breaking ground and getting contracts signed, et cetera, is in extremely strong written commitment from the M's or the M's owners, because that's crucial to the whole project as an anchor tenant. That's critical. I'm also extremely interested in hearing more about the emergency management preparedness. Everybody knows as an East Lane County Commissioner, you cannot not be interested in what's going on in emergency preparedness, and that's really been an issue. We've used the Lane Event Center for a variety of different issues in the last 2 years relating to emergency preparedness, and I'm not sure if there'll be a year that we don't use it, really, and that there is still critical available space for those kinds of things. I read the memo where we're going to have additional funding, partner to this in order to facilitate just that. But I'd love to hear, more about that in the future as we move things along. We just need a lot more family-friendly events around here, and that's what the Lane Event Center was always meant to be, is a place for our general community to come together and do things where anybody can come at any age. And so this is what I see happening here in this particular project, and keep people, wanting to stay and live here in the Lane County area. Without something like this, having everybody here and all of us at the board considering this, I have been concerned since I became commissioner that the Lane Event Center languishes. It's always the last to fund. We barely keep those buildings moving along. We have a laundry list of capital construction costs that we would love to invest there. Without, as you mentioned, a catalyst like this, I do get concerned over time that the buildings won't have an opportunity, or we won't be able to find other funding methods in order to keep them going, so that we can continue the home show and some of these other small business support economic drivers that we try to do there. And that's also a big reason why I'm interested in this particular project.
Thank you, Commissioner, and thank you for the mention of the catalytic nature of such an investment. So, Vice Chair Trieger.
Thank you, Chair. Thank you, everyone online and here in the room for the presentation. I want to just start by making an overarching statement that this meeting and future meetings, it's not for me, a referendum on whether we value the contributions of the M's to our community and want to do what we can to keep that programming here. As I've mentioned in previous meetings, I'm not a huge baseball fan, but I'm a huge community building fan, and I go to the games because that's what they do and what they are for many folks. And so this isn't a referendum on the M's and the value they bring the community. I think that's pretty widely embraced. I think this fundamental notion, right, of being good stewards of our resource, and the Lane Event Center already is a resource, and are we being good stewards of it with the resources that we have available to put into it? And as both Commissioners Bozovich and Buck have already mentioned, it's somewhat languished, and we have a lot of deferred maintenance, and it really, it's an exceptional campus right in the heart of the largest city in our county, and it's not the shining jewel that it could or should be, but again, that is for lack of investment and opportunity. So this is potentially a real opportunity. when I think about this project, I think, I think of the classic, you can either have something fast or cheap or good, but you can't have all three. You can pick the two of the three. And so what we're trying to do is figure out a way to have all three, because the timeline, I think, is our greatest challenge. And it's not internally driven by us as an organization or as a board, but it's driven by external forces. And so I just want to make really sure and really clear that we stay focused on the quality of whatever we might build there and of improvements to the campus, and keeping costs contained, or the mechanisms for funding being something that is that makes good fiscal sense and is sustainable for us. And if we can do those things and meet the timeline that's required by the organization of the team, then that's what makes this a go. But it's really important to me. It's hard not to get pulled into the excitement of it, but I think that's really our responsibility. And it's just unfortunate that that's the situation, but it is. So as I understand it, we have two orders in front of us. And one is we've heard more about moving forward with feasibility assessment around design, build, footprint, maybe what kinds of mitigations to concerns we've heard. I appreciate Commissioner Buck bringing those forward around traffic, parking. We've also heard a lot about noise and light pollution and so on. But the other is also just in executing a contract that keeps the county's interests front and center. So I'm very curious to know, I have two fundamental questions. One is around the contracts and those proceedings, and where are the sort of go, no-go points, both for us as an organization, for the team, or any other interests. There's going to come a point where no matter how hard we're working, we're going to come up against it, whether that's a timeline point or just a decision point. So I'm sort of trying to envision the flow chart and what we're doing. And so I see today as, if yes, keep going. So if we approve these two orders, it's a yes, keep going. It's not a final decision. But where are those go, no go? Those are really hard stop pinch points in the process, and which cog in this whole machine of the project, where does that live? That's my first question.
I'll take a stab at that. Thank you, Commissioner, for the question. So because there are multiple parallel efforts moving forward, and we don't yet know which one is going to get to a critical point yet. We anticipate coming back to the board, as I mentioned earlier, in July or August, with all of the information that we have at the time, understanding that there may be portions of the effort that are still in progress, and we would report on that as such. Because we don't know what the precise timelines are on those. It's hard to predict which, a date for which they will all be in alignment. So it may be a series of incremental steps towards that cumulatively reflect a go, no go. My preference is to come back to the board with frequent updates, even if some of those aspects are still in progress, just so that we keep it on the radar and we have as many questions and concerns fleshed out and put on the table as early as possible. So I think because of the size of this, the scale of this, and the impact to the community, the impact to the catalytic nature of what it can mean to the rest of the Lane Event Center, I think more frequent updates in smaller, more digestible chunks, if you will, I think will be helpful for us as a team and perhaps helpful for the board as well. So all that to say that I think at our next visit, we may not have all of the information for a go, no go, but subsequent return trips would reflect that.
I would just add that there are probably three really critical. Number one is funding, right? In your packet, and we reflected on this. We've identified approximately 1/3 to 2/3 of the estimated cost of the facility. So we still have ways to go to close that gap. One of the things we're asking for the board to direct us on is if you would like us to bring back various funding options. So there's funding identified from the team, there's funding identified from the legislature, and there's funding identified from existing funds within Lane County in the Lane Event Center that is currently going towards debt. But there's a large gap of new revenue that needs to be identified. So that's one, I would say, critical piece is identifying the funding. The design and neighborhood impacts is another one that, and that is part of that engagement with the neighborhood and the community around those impacts. So we've talked about the need to go out and begin the process of identifying design services. It doesn't mean we're going to execute those services, but at least make those available if and when the funding can be identified and made available. So 1, funding, 2, design and neighborhood impacts and community engagement, and then 3 is timeline. So obviously there are these timeline constraints that the team is under and all of these things. So those are 3 pieces. I think as Lauren indicated, we'll be back in front, and Sean indicated this, we'll be back in front of you in June around the design build type process, and exception will provide another update at that stage. And then the plan is to come back around the July timeframe with those additional funding options for the board to consider. And that really will be a critical time that we'll need to say, okay, this is how we could potentially make this project happen. And the board is going to likely need to make some decisions at that time frame. So I think we're in this window of the next 2 to 3 months is going to be really critical to determine if this project will happen or not.
Thank you. And so really what that comes to is both these orders go together. We need them both. And so what we're talking about is investing $190,000 to keep exploring the feasibility and go to that next level of discussion and assessment of all those pieces that you just mentioned, right? So that's
and I would just add, Commissioner, sorry, you heard the team indicate their support to continue to assist financially in those efforts to allow that ball to keep moving forward. But it doesn't mean that this is absolutely going to happen. It means that we're keeping those options open while evaluating all of the impacts and desires as part of the process.
Understood. Thank you. So my last piece is about that community engagement. And I think it was Lauren who mentioned, when you come back before us next, there'll be sort of findings on community engagement. So what is the plan? Who will be conducting that? Is that going to be internally driven? What is the plan for that community engagement and how we're offering it, how we're framing it, who we're involving, and what we'll do with that information?
So the plan at this point is to research or consider partnering with a local or regional PR firm. We've done that in the past for other large efforts, as I understand. We feel that this, because of the scale of this and the impact of this, combining our internal efforts around engaging with the community, as Corey indicated, with Westside Jefferson Neighborhood Association and other stakeholders and stakeholder groups, partnering our internal efforts with some external additional expertise, if you will, we think is going to be the best way to move forward on that. My understanding is that the cost for that is not significant, and so did not necessitate a board order. And so we have not taken a tangible step on that yet, but have it queued up and ready to go to begin that should we get the direction to move forward.
Great, thanks. And just for anyone who's watching or listening now or later, just to be clear, I want to be sure. You tell me if I'm getting this right. When we say PR firm, I think some people in the general public hear a firm who's going to try to spin or sell the community on a project. And really what we're talking about is an organization that is outside of ours, so they can actually be a little more objective in creating a process that doesn't have a predetermined outcome, as well as just capacity for staff, that we don't, because of the timeline, that becomes their whole job is to do that process and do it well, rather than us trying to sort of add it on to other folks' workload.
Yes.
Is that accurate? Great.
More accurately described.
Yeah, thank you. And I would hope that community engagement includes not just community as in the neighbors, but other entities like we talked about with transportation. So Lane Transit, City of Eugene around traffic planning, and other entities, not not simply the neighbors directly affected, and how far out those concentric circles go, right? Because those impacts are well beyond the immediate surrounding neighborhood.
Yes, Commissioner, that is, you know, we partly because of the capacity, perhaps at least in my case, lack of expertise around what that looks like is where that additional expertise would be helpful. There's a breadth and depth to that engagement that is needed, you know, scaling out into the community, not just the local community, but the other stakeholder groups, as you indicated, as well as gaining a deeper understanding of what those concerns are. And with those concerns will come ideas and options towards mitigation and helping paint a picture of what viability or feasibility might look like.
Thank you. Yeah, and then but lastly, obviously, those other stakeholders include other users of the event center who've been, you know, tenants or renters for decades, right? And some of the other uses of the buildings and other partners that we have there. So great. Thank you very much. Appreciate it.
Thank you, Vice Chair, and thank you to the board for the questions. Ms. Morgheisi, you look like you're ready to say
some wrap-up comments. So whenever you're ready to sort of start thinking about wrapping up, let me know.
Well, you know, one of the best parts about being the chair is that I get to go last and hear the other questions first and not repeat them or repeat them strategically, which may happen at this point in time. But I want to mention, Vice Chair Trieger, you talked about community engagement being more than just the neighbors. And it, in fact, is. Corey, you and I this coming Thursday will be participating in some community engagement with our local hospitality industry folks, restaurateurs and hoteliers who do have a vested interest not just in the generation of TRT, but also in the distribution of TRT. And we'll be fielding questions, and that community input is wide and broad, and there are very few people in the community who don't have some form of an opinion on us moving forward with this. Ms. Morgheisi, to you, you and I talked a little bit earlier today about this being, what we're doing today, the two orders that we're passing are part of the due diligence in moving forward. There is a cost involved, but it's a cost of performing the due diligence, answering questions that may indeed bind us up against some stop points that prevent us from moving forward. And Ms. Morgheisi, you identified three, and I really appreciated that, three but the stop points, funding being one of them. We're looking at the additional sources of revenue. You mentioned the design and neighborhood impact being one of the stop points, and you also mentioned timeline constraints, both by MLB and by the University of Oregon, which all kind of wrap together. To me, that really boils down to that. And if we're going to answer the questions that address those potential stop points, that is when we move forward. And that's the process we're in right now, is finding ways to answer the questions that potentially could be stop points. You know, to me, there are two things we're looking at right now. One is the overall picture of what is it like with having Major League, having a long season single A ball here in town. What does it look like? And that's a wonderful picture to me. You know, I can hear this, right? and hear the crowd roar. You know, I mean, who can not appreciate and enjoy that? And the second part is what we are really actually doing today. We're not talking about the overall impact of baseball in the community. We're talking about how do we move forward from this point today forward. And we have two orders before us. That's what we need to do today is consider the two orders, which will allow you, Mr. Morgheisi, to step forward with the due diligence that we're talking about. So, you know, I want to ask about the other uses of the stadium. I think that'll come later. You know, how do we use the food carts? How do we use the stadium itself for pickleball? That's just throwing that out. And I'm really intrigued about the possibility of configuring it as a cricket ground also to accommodate the vastly expanding fan base. I'm kidding about it. But you know, that being said, today, board, we do have two things that we need to consider today. We have two orders in front of us. The first is Order 22-05, 24-06 in the matter of approving the contracts, and the second is -07. Before we get to the orders, before I ask for motions, Mr. Morgheisi, your summary, please.
Thank you, Chair and Commissioners. I just wanted, each of you talked about the Lane Event Center, and I wanted, as we, you know, we've been talking about this for a while and the concepts, and it's talked about in different ways, right? You heard Mark and Phil call it a ballpark, and let's be real, it is a ballpark. I mean, that's the primary use of it. But I think, you know, Corey did a great job of articulating, and you all reflected on this, that the Lane, we have a very unique event center and fairgrounds. I actually have never, in my both travels and work experience, never experienced, particularly a community like this, of this size, to have 40 plus acres in the location that we have it. And so it's more than a fairgrounds, than a typical county or state fairgrounds that you would see it. This is why we call it the Lane Event Center, because we have these indoor facilities. And of course, we do have a lot of winter months. Appreciate that comment and question from Commissioner Bozovich that, you know, from October until the end of April, we're booked. And it's actually the summer months that there's more opportunity to grow that there. But what, as Commissioner Buck talked about, this really is a gathering place. And I think one of the things that we've been excited about, this community loves the M's. Even more than the M's, we love the community, right? And so we've seen the opportunity that is presented through this partnership to really solidify the Lane Event Center as a true gathering place. So we do celebrations there. We have events, and we have a lot of times throughout the year in which we celebrate. And then, as Commissioner Buck pointed out, we respond to emergencies, and we can think about the holiday farm fire and the animals that we sheltered, and the multi-resource center that was set up for those affected by the fire to go receive access to services. Through the pandemic, the mass vaccinations that we held at that facility, and it was one of the, frankly, the highlights of the pandemic, was seeing the stream of cars in and out and the white tents with the vaccinations happening there. The smoke respite, where we opened the event center for individuals, particularly unhoused individuals, to have a respite from the smoke. The shelter, before the last 2 years of emergencies, the facilities, the indoor facilities that were used for shelter, and that's those are the emergency response pieces in addition to the year-round activities. We have some incredible facilities, particularly sporting facilities in this community, you know, between Autzen Stadium and the new Hayward Field and PK Park, world-class sporting facilities. But they're not community gathering places. They are places for all of us, for many folks to go and enjoy different events, but they're not the community's facilities. And so I think as we talk about and consider this project and this partnership moving forward, really thinking about it in the context of the community's gathering place, and in the context of the broader Lane Event Center there. So I just wanted to, again, there's a lot of work to happen. There's a lot of information that we need to provide to all of you to be able to make an informed decision. There's a lot of feedback that we need to continue to take in, but I want us to keep those ideas and that vision in mind as we move forward. So thank you to everyone who's been here and the work that has been put into this, and thank you, commissioners, for the time and the discussion today.
And thank you, Mr. Monker-Heisey, for bringing this next step before the board. And to the board, then we'll look at the two orders before us. And let's begin with Order 220524-06 in the matter of approving one contract amendment with Goldfarb and Lippman LLP and delegating authority to the county administrator to execute the amendment. The order is written in completely in the agenda packet, which is available on the agenda if you click view items. So, regarding the order, discussion or motion?
I'll move approval of Order 22-05-24-06.
I'll second.
Moved by Vice Chair Krieger, seconded by Commissioner Buck, and this would move the contract amendment in the amount of $50,000 to Goldfarb and Lippman, and delegating authority to the administrator to exercise the contract, execute the contract. Discussion to the motion. Commissioner Bozovich.
Thank you. I'm really happy that the administrator talked about this as a community facility. I want to make sure people are aware that as we vote on these two contracts to further explore this project, this isn't a done deal yet. That we have many other decision points that have been described in the presentation before we get to, we're moving ahead. So I want people to be aware that my vote on this isn't necessarily saying that we are to that point. I also want to say that you know, I'm glad it was described as a community facility because, and I'm sorry, DG, Gant, and Alan, this is important to me not because of the M's. This is important to me because the event center and keeping the event center viable. They're an anchor tenant and a partner, and I appreciate their partnership in helping us move this forward. And I just want to, you know, address that emergency portion of this a little bit because having been an engineer and worked with developers and all that, the fact that we are making this in a facility that's going to serve as a, you know, helping our emergency response makes it under building code a critical facility, which requires it to be built to seismic zone 4 rather than 3, which is typical for this area, which means it will be standing at the end of the subduction zone earthquake. So when you think about long-term, you know, emergency planning in this area and what facilities we are going to have operational and available to us at that time, this is going to be a critical piece of serving our community. So that, you know, that's why I continue to stay interested in this is the economic viability of the fairgrounds, which employs a lot of people. I can't remember the last financial impact statement we had and how many millions of dollars it brings into Lane County, how many room night stays during shoulder months it creates. So this is really important, but I do just want to make sure people are aware this is not the final vote on this project. This is just continuing to explore getting a possibly great addition to our community and something that's going to serve us in so many different ways, economically and emergency capacity. So I will be voting yes if you haven't guessed.
Thank you, Commissioner Bozovich, especially for the part about the emergency potential use for the facilities in not just a subduction earthquake, but really that the county has facilities that we are able to use. Further discussion to the motion, Vice Chair Trieger.
Thank you, Chair. Not so specifically to the motion, but just amplifying that not only do we need a facility in Lane County, or that this would be a facility in Lane County built to seismic standards, but that there are precious few of them. And there really aren't any that are publicly owned and could be used by the county to stand up our own emergency operations so we can respond to community needs in the event of an emergency. So in future presentations, if we want to have patients come and speak to that, or at least have a component of the board packet be part of making the case for the multi-use, specifically emergency response component of the positive benefits that a facility like this would bring to the Lane Event Center.
We'll consider that a double underline of that particular use of the facility. Further discussion to the motion. Seeing none, we have before us Order 2205-2406, moved by Vice Chair Trieger, seconded by Commissioner Buck. I'll call for the vote. All those in favor, please say aye. 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 Passes 4-0 with Commissioner Burney absent, excused. And now we have before us Order 2205-2407, also in the matter of approving the contract, this time with the IFG, International Facilities Group, and authorizing the administrator to exercise. Do I have a motion?
Chair, I'll move passage of Order 22-05-24-07.
I'll second.
Moved by Vice Chair Trieger, seconded by Commissioner Buck. Discussion to the motion. I think we've exhausted discussion to motions at this point in time, so I'll call for the vote on Order 2205-2407, moved by Vice Chair Trieger, seconded by Commissioner Buck. All those in favor, please say aye.
Aye.
Aye. Passes 4-0 with Commissioner Burney excused absent. Mr. Mokrajski, any further discussion or toward this to this agenda item?
No, we have work to do, and we'll be back in front of you in future weeks. Thank you.
This was not the end of any work at all. This is a part of due diligence moving work forward. Thank you very much for your attendance today. DG, thank you for being here today. Thank you all for being here today, and I look forward to working with you toward the future as we answer questions. Mr. Mokrajski, thank you. With that, we come to the end of business for the morning. We have no call for executive session this morning. Is there any other business prior to recess, Mr. Mokrajski?
No.
I see none. Then at the sound of my gavel, we'll be in recess and reconvene at 1:30 in Harris Hall.